We got your 6.
At 6 a.m. with The Link on Breeze 93.9 FM. Bree and I connect you with all the latest news and information
What are the
you need to know to start your day.
Then check back with Guam's news leader at 6 p.m. for the day's top headlines with KUAM News Primetime.
From 6 a.m. to 6 p.m. and everything else in between with KUAM Digital, we got your 6.
Sinya uli di sombranza tamak e zu ita saluda antes di niga radzaudzan malak estrezas durante todo el memu a no distancia como kupugi palu zaniman malak guafi ikonum nasugi Nai banderata gaigi pues atan fani bandera kau esta pagua pumalapa gilo tanu man libri Sentamiti man ko badi
Panogi tamoru purita nota kantai matu nanyagi todu ilugat para honra para gloria abiba isla sin parat para honra para gloria abiba isla sin parat todo y tiempo y paz para kita dan gini langit na bendisyon koncay piligu na fan sofuham Zeus protehis languahon koncay piligu na fan sofuham Zeus protehis languahon
Osaina, Oaniti, Inumari Hamines Kuntan, Minale. Osaina, Oaniti, Inumari Hamines Kuntan, Minale.
na 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 na, hey, yeah, 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 yeah. Ooh, na 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 na, hey, yeah, 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 yeah. Ooh, na 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 na, hey, yeah, 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 yeah. Ooh, na 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 na, hey, yeah, 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 yeah. Let me surprise you with your favorite things. Dance with me by the ocean under the moonlight. Cause I'm loving how it shines on you as the sweet, sweet scent of your perfume just takes me away to a land of peace, near the sea of love, near the gardens of nature in the heavens above. And I know it's real, more than a dream, when you're alone with me and just falling in love right here in paradise. Ooh, I hope you're loving the view. Let this tropical breeze set you in the mood. Just falling in love right here in paradise. Ooh, I hope you're loving the view. Let this tropical breeze set you in the mood. Oh, ooh, na 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 na, hey, yeah, 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 yeah. Ooh, na 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 na, hey, yeah, 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 yeah. Ooh, na 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 na, hey, yeah, 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 yeah. Ooh, na 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 na, hey, yeah, 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 yeah. I bet you're tasting like coconut candy. Oh, honey, may I take a bite in this love story? Let your uncle the gun move shake with no worry. And tomorrow we've been doing it all over again. I bet you're tasting like coconut candy. Oh, honey, may I take a bite in this love story? Let your uncle the gun move shake with no worry. And tomorrow we be doing it all over again. Just falling in love right here in paradise. Ooh, I hope you're loving the view. Let this tropical breeze set you in the mood. Just falling in love right here in paradise. Ooh, I hope you're loving the view. Let this tropical breeze set you in the mood. Sing, ooh, na 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 na, hey, yeah, 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 yeah. Ooh, na 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 na, hey, yeah, 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 yeah. Ooh, na 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 na, hey, yeah, 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 yeah. Ooh, na 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 na, hey, yeah, 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 yeah. I bet you're tasting like coconut candy. Oh, honey, may I take a bite? This love story. Let your uncle the gun move shake with no worry. And tomorrow we be doing it all over again.
All right, let's go. Good morning, Guam. Good morning, Sabrina.
Oops. Good morning.
Morning, Jason.
Hey, Hafade, good morning, everybody.
Good morning, everybody, especially on our Facebook live feed and right here on the island of Guam, listening on the breeze. We're KUAM FM 93.9. Good morning on you.
Good morning, Rich Rossetti and the crew over at the Agate Fire Station.
Hey, I know Rich. Hey, and shout out to Rich's brother Ken, who's living in Houston right now. Ken, miss you, bro.
Also, Bunk Mano writes, good morning. Ginemalolo. Emma Olalia writes, good morning to you all. Have a blessed day. Be safe.
Hey, and Bunker's going to be on the show later, right?
Yes, we're doing our KUAM News Decision 2020 interviews, 9 a.m. Angelina SV, Las Vegas.
We got a shout out coming to us from Filomena Cantoria. She goes, Hafade from Oregon. I miss you all. Also, Dr. Cantoria was a very, very good accounting professor at UOG. I took her class. She's really good. Hi, Dr. Cantoria.
Also, Vincent De Leon Guerrero. Hello from Saipan.
All right.
Off a day to M. Jane Davis from the 801.
Nice.
What is 801?
I figured you know.
Well, let's see.
Right. That's like, hold on, stay by Hawaii, brother, because Hawaii
No,
stayed
that's
808.
808. All right,
Yeah,
here we-
they stay
wait,
at
here we go.
808, but they stay right next door to 80.
Okay,
One.
Google. What is a 801 area code?
Thank you, nerd. The 801 area code.
Salt Lake City.
Oh, Utah. There you
Utah.
go. Jerry Flores writes, good morning from NCS. Marissa Alcantara, buenas and half a day from the Alcantras in San Diego, California. Guys, you okay? You okay over there?
Oh, we got one.
Half
Hello.
a day to the GMH ER staff.
All right.
Oh, yeah.
Colleen Duenas.
Also, let's shout it out to GMH ICU staff. To Ron Castro writes, good morning from the Presto family here in Bellow Road. Good morning, Bellow Road.
Marie Cruz Taikenko says hello from Santee, California.
Half a day from Annie Bonds, watching streaming from Killeen, Texas.
Eldon Haka writes, good half a day, Chris, Bree, Jason, the people of Guam. Love greetings to Princess Aldolfo and family. Hope you're listening. Love lots from the Philippines.
We got a shout out now from Marky Boy on Twitter saying Hafaday from Miramar in Florida. You know what? Miramar. That's where Top Gun happens. Top Gun 2 coming out sometime.
Okay. Ken Guerrero writes, good morning, Dedido in the house.
Franklin Meno, Ginin Malolo, half a day.
Tina Red, half a day from Modesto, California.
The Philippines is checking in. Mabuhay, everybody.
Frankie Jr. Rages, good morning, my Matic. Not you, Matic, my Matic.
Ha. Way up in the northern part of Florida. Half a day to our friends in Jacksonville from Roxanne Jones. Half a day, Jacksonville. Go Jags.
Jan Mendiola, hello from Washington to 360.
Yeah, you guys use your area code. That'd be cool.
Tamara Cruz, off a day from Vancouver, Washington. We also have Jamie Lynn, Marie Lazama. Good morning from Jotnia.
We got a special shout out from Eldon Jaka, who's watching from the Philippines. He says, greetings to Princess Adolfo and family. Hope you're listening.
I got an idea. Okay, so if you guys are joining us from anywhere else in the world, use your area code. If you're joining us on Guam, put in the comments. Use the
Use your village area
your,
code.
your phone prefix. So half a day to everybody in Dedido. 632 is in the house.
Yeah, well, that's a lot of numbers now are the same.
And 637.
Right, yeah, or 969.
There we go.
What else you got here? Lena, Judine, Taitagui, Buenas from Ipan. Ipanese in the house. Jack Larimer, half a day from Mungie Town. NCS Dedido with Gina. Good morning, NCS.
Hello, Marie Cruz Taikenko, watching from Santee, California.
Half a day and good morning, MTM.
Oh, nice. Lots of nice houses all the way. You guys ever like take a stroll like way in the back, like really deep in Mongongtok to Maiti? There's some really nice houses back there.
Yeah, it's very, very cool, Bill.
Yeah.
Agania, good morning. Agania Heights, Sin City, Agafagumas, good morning. Agat, Santa Rita.
I want to say Hafaday and good morning to everybody in Tizen. A special bonus Hafaday if you still call it Naval Air Station.
Half a day, Jan Manjola, Washington 360, Tina Red from Modesto, California. Thanks for streaming.
The 209. What? Tina writes, I visited 2 weeks ago and Guam needs a lot of help. What are you trying to say, girl?
Hello, Tamara Salas Cruz from Vancouver, Washington, and also Roxanne Jones, streaming from Jacksonville, Florida.
All right, let's also say good morning to everyone here in Harmon. Let's go Barragata Heights, Barragata, Mungie Town, Manila, Orda, Chalampago, Pago Bay, in Lahan, Molesto, Umatic.
We got shout outs, area code shout outs from the 253 and the 360. That is Northeastern Washington.
Nor'easter.
Nor'easter on the.
Mayor Luis Rivera,
Northwest.
holiday from Tamuning, Mayor. Good morning, Mayor.
Oh, there we go. We got Gilbert Cruz coming in from the 808. Hey, aloha.
Oh, brother. Want to stay in Hawaii. Eric Kaipad writes off at Guam. Zen Saipan, be safe. Good morning, Chris and Sabrina and Jason. Naomi Taitano watching from Jigo. Good morning, Guam.
All right, another shout out to us coming on Twitter saying, Hafaday, miss my island home from Oceanside, California. Oceanside, of course, the home of the late Junior Seau.
Also, Melanie writes, half a day, good morning from Beachway.
Hey, nice.
Aaron Redoble, watching from Machinano. Good morning.
Machinao now.
Hafaday to everybody in Tumon on Happy Landing Road. You guys ever work out on Happy Landing Road?
No.
Like try walking up. It's a challenge. That'll get you breathing
Kind of
pretty
dangerous, too.
Christine Hokuk, all gone. Half a day from Mangilao. Good morning, everybody.
Yep. That covers it.
Good
You
morning.
guys, you good? We can keep saying good morning for another 10 minutes if you want.
We're good.
Wow, it's a beautiful morning here. Tuesday, the 6th day of October. Welcome to The Link. My name is Chris. Sabrina Sauce Mentanani. Good morning, Bree.
Hello.
As always, a great, big, huge show for you guys this morning, and it's brought to you by our friends at Calvo Enterprises, IT&E, and, of course, the Thrive Coalition. Okay, the Thrive Coalition presenting a great health and wellness segment today, and they're reminding you that it takes a village to raise healthy and drug-free youth. Also, want to shout it out to Carrier Guam, located in Tamuning behind Kmart. Call them at 647-COOL. That's who got that number. That's the number I wanted. It's 647-2665. Carrier.
That's a great vanity number.
Yeah, thank you. Thank you guys for sponsoring the Link on the Breeze. The number 637-0094. Reach out and touch us. Get you on. We'll tell you more about our Pepsi Pizza giveaway this morning, Bree. That's coming up.
Yeah, we actually got a chance to visit Crust yesterday, and oh my goodness, the pizza is just amazing.
Yeah, and so we'll show you what it's all about. Also, this morning, we'll get the Guam Behavioral Health and Wellness Center Director, Teresa Ariola, on. We'll also talk with Miss Gayleen Cruz, whose husband is hospitalized at the GRMC, and he's a diabetic patient, non-COVID, but she just really wants, they're not accepting visitors, but we'll get her whole story on. She's trying to get in as a caregiver. Really just a tragic story, and another example of how there's so many casualties of COVID that sometimes aren't necessarily COVID. We'll also catch up with, did you guys go to Mass this weekend? Because if you didn't, we'll pretty much have a kind of Mass this morning with Father Richard Kidd and Father Paul to kind of catch up on the Masses they had over the weekend and what their parishioners are saying. It was interesting because both of them, I was trying to get them on yesterday, but they do Mass at 6:30. And so both of them were texting me afterwards. They're like, hey, sorry I didn't get back to you, but they had a couple of people who went to the Mass and stayed back just needing, some priestly counseling, right? And that's one of the jobs of a priest, too, is they're almost like, they are like therapists, counselors. So that was interesting. Our Thrive segment, 8 o'clock, we're going to break our fast with Beverly Coleman, who's a clinical program director at WestCare. They were awarded a $1 million disaster response, $1 million that is, disaster response grant. And we'll talk about a great program that they're standing up with GDOE. It's mental health treatment services for youth 11 to 17 affected by natural disasters, to include the COVID-19 pandemic. Also, public health and social services. We'll be catching up with Bertha Tyron. How do you get an exemption to quarantine? We'll outline the process at 8:45 with the Department of Public Health and Social Services, and then hopefully maybe ask them some virus questions if we get the chance, because the number of positives reported last night. We also had, Bree, 3 deaths.
Yes, 3 deaths. Really sad.
It's tragic. It just seems like right when I'm about to lay my head down to, it's crazy, Bree, because the last couple nights, just saying my prayers at the end of the night, I've been like, thank you, Lord, for sparing people from the virus, and then boom, right after I'm done with the prayers, I get the release, and it's like somebody died or some more than somebody. Last night we had 3, so definitely our condolences going out to the families. So we'll obviously talk about that this morning on The Link. Let's get right into it. It's 6:26, Tuesday, the 6th day of October, with the very latest from the KUAM News team. Good morning, Sabrina Solis Matanani.
Off today, everybody. The number of COVID-related fatalities has gone up again late last night. The Joint Information Center announcing 3 more deaths. The 53rd COVID-19 related fatality occurred at the Guam Regional Medical City just before 6 p.m. this past Saturday. The patient was a 68-year-old man with underlying health conditions. He was admitted to GRMC that same day and tested positive upon admission. The 54th COVID-19 related death also occurring at GRMC at approximately 6 p.m. on Sunday. The patient was a 47-year-old woman with comorbidities. The patient was admitted to GRMC again that same day and tested positive upon admission. And the 55th COVID-19 related death occurred at Guam Memorial Hospital at approximately 7 o'clock last night. The patient was a 51-year-old woman with comorbidities. She was admitted to GMH again yesterday and tested positive upon admission. Governor Lulian Guerrero commented, as we continue to mourn those lost in the battle against COVID-19, I'm saddened with the news of 3 more members of our community who have succumbed to this terrible virus. She adds, don't wait until it's too late to get help. COVID-19 related or not, the best thing you can do for your health is to get treatment. If you're feeling sick, go to your doctor or call 311 to reach their nurse triage hotline if you need more information. The sooner you come in, the sooner our doctors and nurses can treat you and help you get better. As for the latest numbers, out of 609 samples ran at various labs, 54 returned positive. This brings Guam's COVID case count to 2,753. 804 residents are actively fighting the virus, with more than 1,800 people recovered. As for the hospitalization rate at GMH, the JIC reports as of last night, 33 COVID patients were hospitalized, with 13 receiving ICU level of care. News out of the Department of Corrections. Public Health has completed COVID testing of more than 700 inmates and detainees at the Adult Correctional Facility, the Women's Facility, the Community Correctional Facility, as well as the Hagatna Detention Center. According to DOC, all tests returned negative and DOC remains COVID-free. The CNMI government, meanwhile, announcing 2 more additional COVID positive cases, bringing their total COVID count to 75. According to a media release, the individuals were identified by travel screening and confirmed diagnosis through testing upon arrival. They have been moved to a designated isolation area for monitoring, and contact tracing has begun. This next story is a heart-wrenching one, as 3 sisters stuck in a GovGuam quarantine facility plead with the government for compassion and understanding. Having just lost a sister days ago and then given false hope for release to home quarantine, Adriana Cotero reports.
If there's ever a time for compassion and understanding of a situation, it's right now.
Kelsey Vargo, Jill Braithwaite, and Holly Mantano's sister, Jamie Ellis, suddenly passed away last week. And within minutes, these 3 sisters booked a flight from the States to Guam.
It's devastating news to lose a sister so unexpectedly, and to have been so far away from her, and to not be able to be with her children right now. It's unbearable.
Ellis passed away from an unrelated COVID-19 illness. She moved to Guam 3 months ago with her husband Preston and their 3 children. Upon hearing the devastating news, the 3 sisters applied for a hardship exemption in hopes of quarantining at Ellis's home.
When we arrived at the airport on Friday evening, Guam time, we were met with co-workers of our brother-in-law who had said the governor sends her condolences, and they're working with the Department of Public Health director to expedite our request and administer COVID tests and allow us to go be with my sister's children and her husband.
Despite being told at the airport by government personnel that they would be administered COVID-19 testing the next morning, now days later, and they still have not been tested. And their exemption request has since been denied.
So we were just waiting for our COVID test, and about 48 hours into our stay here, we received word that our request had been denied. And that we would need to stay in the government quarantine facility for the 6 days, which unfortunately that day 6 is our anticipated return back to the States, when we hope to take our sister's children back with us.
According to the sisters, the Department of Public Health denied the request because a memorial has not been scheduled for Ellis.
If you want the definition of heart-wrenching, that's it. To be so close but unable to be there physically with them.
Thursday of this week is day 6, when the sisters may test out of the mandatory quarantine. Although Kelsey, Jill, and Holly remain hopeful that they will be able to hold their sister's children before then and mourn together with their family.
We're reaching out to as many people as we can to try and get a test and then granted to quarantine at her home. That would be our wish. However, if it doesn't happen, we'll change our flights and we'll stay on the island days longer and be there for those kids.
And so we did get a call from the sister, or a message from the sisters. They said, thank you for all your help getting our plea heard. Senator Sabina Perez, office manager, and the senator herself had called the sisters, and they received their COVID test yesterday, and the results were expedited. They were supposedly released last night with their family. To their family. Chris?
Yeah, Maria, and then also they had shot a message. I asked them to come on via Zoom to kind of share the developments in their case yesterday. They said, thank you, Chris and Sabrina. We're going to try to put all our focus on why we came to Guam and give our attention to the family. So thank you again. And you know, again, our condolences, and just happy that worked out, you know, given the circumstances for the family.
Right. And with more news, here is Tyler Mazzanoni.
Hafa good morning, everyone. I'm Tyler Mazzanoni with your headlines here on The Link. Restaurants and bars remain under tight restrictions, with indoor dining still prohibited. Popular establishments like Moses Joint and Carabao Brewing believe it's unfair that other industries can operate more freely than they can, even though their industry is being just as diligent in sticking to the health and safety protocols. Moses co-owner Monique Amani.
I believe that the restaurant business and the bars and everything, I think that they're all following the guidelines too. And if they aren't, then they should get shut down. And, you know, I understand where the governor is coming from completely about being safe, because the cases have spiked so tremendously the last month and a half. But I also feel like this is detrimental to all of our livelihood, you know.
Carabao Brewing owner Ann Johnson says they're fortunate to have space for outdoor dining, but it's the ever-changing rules that are making it hard for businesses like hers.
It's detrimental to the business to have to guess what you're going to do 4 days from now. Do we buy more produce? Do we not? So that's been really tricky. For us, we have the distinct advantage of having that outdoor area. I fought for that back in May, June, and July. I went through the paperwork. I went to multiple agencies multiple times. I had the support of my landlord, which was incredible. And so I have that opportunity, but I fought for that for months.
They are hopeful that restrictions will be further eased soon. They say they're not asking for special treatment, but rather it's a matter of survival and keeping their employees employed. News from District Court: former Jotnia Mayor Jesse Blas's sentencing hearing is expected to take the entire day of Friday, November 6th. It was in September of last year Blas was arrested for allowing drug trafficking through village cluster boxes. He has since pleaded guilty to 1 count of extortion and faces a maximum imprisonment of 20 years. This afternoon, both parties met for a joint status hearing in Chief Justice Francis Tydengo Gatewood's courtroom. It was stated that both the government and the defense plan to call up the government's informant, Brendan Kinian, to testify. And based on COVID restrictions and quarantine requirements, Kinian's arrival flight lands on October 18, with her being released from quarantine by November 2nd. Additionally, during the sentencing hearing, the government plans to have 2 case agents testify and will play lengthy videos turned into evidence. One of Guam's big 3 telecom companies has just gotten bigger. ITNE announced it is acquiring the telecommunications assets of iConnect Guam. These include iConnect's wireless network and push-to-talk customer base. In a statement, ITNE CEO Jim Olderking said the acquisition will allow us to continue with our improvements to our network coverage and data capabilities in Guam and the CNMI. iConnect has been serving the island communities for more than 20 years and is a pioneer in the local telecommunications industry. iConnect took over Motorola's mobile radio network in 1999. ITNE says subscribers' phone numbers will remain the same and will be advised if a SIM card replacement is required. Customers should also continue to pay their bills and seek assistance online at the iConnect website. Jack in the Box will open a second restaurant on Guam. The national fast food chain announced that a new freestanding store will be built at the corner of Marine Drive and Alaguagua Way in Tamuning. at the site of the old Pizza Hut restaurant. Completion is expected by the end of next year. The restaurant will feature one of its largest designs to accommodate indoor dining and a drive-thru. According to Donna Yano, Vice President of Jack in the Box Hawaii, we are pleased to announce our further investment in Guam, which we know can help support the local economy and provide more career opportunities for the residents in the long term. Jack in the Box opened here in 2014 and currently has one outlet at the Shell gas station near the Micronesia Mall. That's the news for now. We'll see you all at 6 tonight on Primetime.
Thanks, Tyler. In national news, President Trump's doctors say the president could be released from the hospital as early as today. Natalie Brandt has more details from outside the Walter Reed Medical Center.
President Trump sent a flurry of tweets this morning from the presidential suite at Walter Reed. White House Chief of Staff Mark Meadows told Fox News the president could be discharged as early as today.
The president, in consultation with the doctors, will make a decision on whether to discharge him later today.
But questions remain about the president's condition. The president's doctors now acknowledge he had a high fever on Friday and say his oxygen levels dropped twice. We've also learned the president has been given the steroid dexamethasone in addition to remdesivir and an experimental antibody cocktail.
The question is his disease much more severe than is being described? Because there's a discrepancy between the potency of the drugs and what's going on.
The White House is also facing backlash after the president left his hospital suite Sunday evening to drive by supporters who have taken up vigil outside Walter Reed. Administration officials say the president's doctors approved the trip where he was seen wearing a mask, but health experts say he risked exposing his security detail to the virus.
Leaving a hospital, going into a car with other people, is not being quarantined, and certainly it is putting people at risk.
Prior to that trip, the president released another video where he says he now understands the coronavirus.
It's been a very interesting journey. I learned a lot about COVID.
White House Press Secretary Kayleigh McEnany, who was not wearing a mask when she briefed reporters Sunday evening, says she tested positive for the coronavirus today. She joins the growing list of people either close to the president or who attended the ceremony for Supreme Court nominee Amy Coney Barrett, who have since tested positive. Natalie Brandt, CBS News, Bethesda, Maryland.
Calvo's Insurance is temporarily closing the automobile and homeowners insurance department for several days. According to a media release, they are taking this precautionary measure due to close contacts that were reported to them Monday afternoon. Precautionary actions include testing of employees, assistance with contact tracing, and professional deep cleaning sanitization of their offices. Calvo's Insurance encourages customers to contact their Dededo office at 632-6316. That's 632-6316 for any home and auto inquiries. They will also continue servicing customers through email at ciupc@calvos.com. And finally, AIDS Care China, a community support group in Ganzhou, China, for people with HIV/AIDS, donated 30,000 surgical masks to the University of Guam Endowment Foundation for its Guam COVID-19 response project. Guam Memorial Hospital received 20,000 of the masks in September. Guam Behavioral and Wellness Center received 1,000, and 9,000 will support the work of the UOG School of Health and other frontline healthcare workers. Executive Director for the Endowment Foundation, Katrina Perez, says, in these unprecedented times, it is wonderful to see individuals band together and to have donors from both near and far helping the community of Guam. That is your news. We'll be back with more in the link after the break.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Pepsi Guam Bottling, a local company. We produce your favorite products right here on island, like Pepsi, Mountain Dew, Hanum, Chamorro Punch, Tropical Ice, and more. We've invested millions into local production and will continue to upgrade our facilities and provide local jobs so you can truly buy local. Our long history of producing the freshest and best products will continue. This is our vision. Pepsi Guam Bottling.
Your generosity can change lives. Disasters won't stop during this global pandemic, so neither will we. The Guam chapter of the American Red Cross is calling on the continued support of the community to assist with their mission of providing disaster relief and recovery efforts, military family support, and life-saving training and certifications. In times of emergency, our support will not waver, and we pray that your support of our efforts will continue as well. We invite you to join us in commemorating our 20th annual signature fundraiser virtually this year by supporting the Red Ball in a Box. We will be delivering special red boxes, which include a 4-course dinner from Micronesian Chefs Association and wine to our patrons and sponsors. As a sponsor, your company and message will also be featured in a special television tribute to the Guam chapter of the American Red Cross. For sponsorship opportunities and more information, please call 688-0280 or visit our Instagram or Facebook page. Let's support our community. Though we're apart, we're still together in generosity and support.
Celebrate National Pizza Month with a Pepsi Pizza Report. Pepsi helps celebrate this tasty month with an easy way for you to win Pepsi and pizza. Post a photo of yourself enjoying your favorite Pepsi beverage to KUAM News, Uno Instagram, or Facebook pages to enter to win Pepsi and pizza from one of 10 pizza sponsors. Catch the Pepsi Pizza Report every Thursday on KUAM News The Link Morning Show and on the social media pages of KUAM News for reports, tastings, and everything pizza and Pepsi.
We all play a role in slowing the spread of COVID-19. We must continue to stay strong and practice everyday preventive actions to keep our island safe. Maintain a distance of 6 feet between yourself and others. Wear cloth face coverings in public settings. Wash your hands for at least 20 seconds. If soap and water are not readily available, use alcohol-based hand sanitizer that contains at least 60% alcohol. Clean and disinfect frequently used surfaces. Avoid touching your face. Stay home if you are sick. Help reduce the spread of COVID-19 by downloading the Guam COVID Alert app on the App Store or Google Play. Let's protect ourselves, our loved ones, and our communities. Prevention saves lives. For more information, please contact 311 or visit our website at dphss.guam.gov.
You're watching The Link with Chris and Sabrina on TV 11, but don't leave yet because we're coming up next on CBS This Morning.
We got your 6.
At 6 a.m. with The Link on Breeze 93.9 FM. Bree and I connect you with all the latest news and information you need to know to start your day.
Then check back with Guam's news leader at 6 p.m. for the day's top headlines with KUAM News Primetime.
From 6 a.m. to 6 p.m. and everything else in between with KUAM Digital, we got your 6.
So I'll be sending all my love to the princess of the sea. Melanesian, Micronesian, Polynesian beauty. Island girl, pretty island girl.
Hey, good morning. DUB. Never gets old, man. Remember when this came out and they were like, the Paul Hunter version, it was like, big up to the Island girls. Big up to Chamorro girls.
I miss actually going out and watching DUB. my little baby. Not so
He's
much a baby
He's a
anymore.
TikTok boy.
Yes, he is. And, Jason helps me monitor his TikTok. But he's so cute. He's very creative on his little TikTok thing. I don't understand, like, the gaming parts. Like, he'll put gaming videos.
Yeah.
Of, I want to say it's Roblox. Or it could be the other one, Minecraft.
Right.
And-
Those are games.
Yeah, those things. He tried to get me to play Minecraft, and I guess like he has his iPad, and then I have it on my phone, and then
You guys can play together, and
yeah, I don't understand it, but he like builds a house and like goes hunting, and
Right.
he's like, "Mom, I'm gonna go get food for us," and I'm like, "Okay," and I'll just walk around like, "What am I supposed to do? Just don't die."
And I actually
Don't
said,
you die on me.
I actually said the other day, I told Brock and I told his mom within striking distance of me right now, and I said, he's getting really, really good at TikTok. You would appreciate it, Chris, because his comedic timing is really getting refined. His storytelling, his editing, like the way he shoots and like sets up like a joke and everything like that, he's really getting good. And what you guys probably saw is you can tell he's 11 now because we shared last week we put it on Instagram, we put it on Facebook, the commercial that we made right before you gave birth.
Oh yeah.
Yeah.
The It's Time commercial. People
Right,
still
right.
go nuts about
Yeah.
that. That was so much fun to me.
Yeah, it was cute.
So what are you doing for your boy's birthday? That has less than 5 people.
Just maybe eating dinner and having cake.
Nice.
What else can we do?
Right. So happy
Which is
birthday, Brock. And that Minecraft, my boys will do a Minecraft and they'll show me, man. They'll be like, oh, check out this thing I've
that's
been.
it.
There's an
Fortnite.
underground pool. Oh, Fortnite too, yeah. 6:51. Let's go to the KUM News Zoom room where we have standing by. We heard from the Action Pack, right? So the Action Pack had come out and, surveyed a bunch of candidates. And there's actually another pack here, the Progressive Democrats of Guam. And I kind of got their release and was wondering what these guys are all about. I mean, I know what Progressive Democrats are, but I thought it was interesting as they're now coming out with a survey that they want candidates to fill out. And then we also have the Vigilance Committee with Lee Weber, and they're sending out a survey. We're getting them on tomorrow, by the way, to talk about that. But let's...
Wait, there's also one that just came out from Esperanza, the Esperanza Project.
Right. This is the anti-abortion.
Right. And so
yeah.
they issued their report, and we can get to that later. But
Right.
first, let's
Yeah.
talk with
So
Julian.
basically, it's election, and there's a lot of political action committees that are coming out, and I think it's cool because this is a weird election. I really feel like, and I'm not throwing shade on the Guam Election Commission because we went to go vote, and they're working hard to make the process of casting the ballot accessible, right, during this pandemic. But unfortunately, there's just a lot of barriers. People are scared to go out and vote. They had this outreach voting at GW. Some of my friends went to vote and waited in line for an hour to cast a vote. And so I feel like there's a lot of reasons why people won't vote this election, right? And I just want to be careful. So what I feel like is like people who are really invested in this process, whether or not it's their Godzu that's running or they want someone to get in, these are the people who have the drive to go out there and cast that ballot. And so we got to make sure we go out and put our votes in there too, so it's not just like those people who are in manipulating the election. Maybe I sound paranoid, but I don't know. I feel like it's
Just a little bit.
a little bit paranoid. Okay, fine. And so I like these little action committees that come out and give us more information about the candidates because in a normal election year, in a normal election cycle, without a pandemic all around us, there would be a lot of opportunities. I mean, we're doing one. We do our KUAM News Decision 2020, 9 o'clock, all the way to the election. But you know what I mean, Bree? There would be a ton of forums.
Yes, exactly.
There would just be many opportunities to hear where these candidates stand. And so what I feel is like a lot of them are just trying to make it to this election without really putting themselves out there. And so that I think it's dangerous. And
There's
that's
always that excitement right in the air. Now it's just like, I hate to say it, like doom and gloom.
Right.
But yeah, everybody just really needs to go out and exercise their right to vote. And like you said, the Guam Election Commission is making it really accessible for everybody. You just have to be safe about it. We went yesterday. We have a piece that we're going to run on it maybe tomorrow and just take you through the process. Obviously, I don't know the difference between the different temperature checking machines. But,
Yeah, we're not the only one.
Yeah.
Like the one they got there, GCIC, I mean, we both kind of did it. I walked up and I'm like sticking my forehead in front of it. And he's like, no, wrist. I'm like, do I put my FAFA? Like, what?
Yeah.
Is it rectal? Do I got to turn around and moon the thing?
Yeah. I was shooting video of Chris. I really wasn't paying attention. And so when it was my turn, I tried to put my forehead also to the machine.
Which is what I had just done.
Yeah, and it, I'm too short, so I was like, I can't reach this thing. And then you're like, hello, dumbass, it's your wrist.
Yeah, I know. And I was like trying to be like, what wrist though? What wrist, bro? Yeah, so it's definitely.
But
I don't
you
know.
do like two different temperature checks there.
Right, just to get in,
Mhm.
right?
Yep.
So, yeah, they're definitely trying to bring the process out to you guys, but it's just really on you to get out and vote. And I mean, I don't know. It's encouraging that they've had almost 4,000, maybe more now, people go out and cast ballots. Let's just get into the Zoom room though, where we have the Progressive Democrats of Guam. We've got Tony and Julian here repping the PDG. Good morning, guys. Tony, you might want to unmic your
unmute.
Yeah, we have Tony Azios and Julian Jansen. Morning.
Buenas, good morning.
Julian, good morning. Digging that headset, bro, with that microphone. It reminds me of Britney Spears.
Okay.
Right. I know, random. But guys, good morning. We'll just, first of all, because, there's Democrats, there's progressive Democrats. Tell us what's the difference between a progressive Democrat and a regular Democrat, or, just tell us what a progressive Democrat is for people who may not know.
Well, we, the Progressive Democrats of Guam, are actually a separate organization. I mean, a lot of us are Democrats, but we're trying to sort of foreground the fact that we're also progressive and encourage other people to take a similar view to us.
I would add to that there's no one agreed upon definition of what a progressive is. So it's an excellent question. But generally, we do share a certain set of values and policy goals, and those can include, at the very least, greatly expanding healthcare, if not pushing for healthcare for all, environmental protection, workers' rights and safety, issues like that. And generally trying to searching for bolder solutions to then what we often find being discussed by the two major parties today.
Yeah. I mean, basically, the way I look at it, it's like progressive Democrats are Democrats who are unhappy with how centrist the Democrats are. Because the way I look at it, it's like you got people on the left, people on the right, and they always try and come to the middle. And when you do that, you kind of lose those ideals that you have on either side. And so Bernie Sanders, I guess, would probably be the best example. Do you agree with that, guys?
Yeah, I would. In fact, our group really came together originally to try to help muster up support for Bernie Sanders here on Guam for Guam's caucus. And some of our founding members at the Progressive Democrats of Guam were actually folks who were elected to serve, to attend the DNC to represent Bernie Sanders and his voters. So, of course, we weren't able to physically attend this year because of COVID, but we did what we could from abroad or from Guam, just like all the delegates did.
So tell us, you're sending out this survey. What are some of the questions that are going to be on this survey you're sending to candidates?
Well, each of the questions is a little bit long because we give a little bit of an explanation before we ask it. But in any boiling it down, we're asking about unemployment insurance, which we think is very important right now with the COVID pandemic and the number of people who are unemployed. Ensuring that there won't be layoffs for government workers, because there's Action PAC and certain segments in the legislature who are trying to push for reducing the BPT by 1%, which would cut revenue a lot and also impact jobs. Another is fair compensation for essential workers. We feel like people should be making $10 an hour to work in the current environment where they're putting their own safety and those of their family at risk by working. We believe that employers should provide PPE, and then of course we have our Healthcare for All question, and then we're asking for senators or potential senators to commit to increasing the resources available for protecting the environment.
So basically, it's 6 different survey questions, and they're open-ended, not a yes or no. They're asked to explain their responses.
Yeah, we asked them whether they basically support what amounts to our position, and then we're also give them a chance to explain. We actually don't give them a limit of how many words as well, so they just rattle on for pages if they wanted to, although I don't think anybody will do that.
What's been the response so far? Are the candidates responding? Because I know that the PAG, it wasn't that many people that candidates that responded.
So far we have two direct responses. We have one statement that a candidate is going to respond, and then of course we have the Republican Party of Guam, who is denouncing us, and basically I kind of feel like that's Tony Atta saying he doesn't want to answer our survey. So, he can go ahead and do that. That's fine. He could have just sent us a little email, but instead he wanted to do a press
getting
release.
a little catty here. So did I miss this? Did I miss? Was there a release from the Republican Party of Guam?
Yeah, there actually was.
So what was it like? Only we can have it back.
Here, it says progressive Democrats prepared to kill our economy and increase unemployment.
Dang.
That was
Pretty
issued
classic
yesterday.
fear-mongering. Pretty classic fear-mongering and pretty baseless is what it amounts to, Chris. I think a better response would have been answering the questions and being able to explain why or why not they support some of these positions. Because I would really like to go back and echo what you were saying, Chris, while introducing this segment, that this is merely an opportunity for engaging with our candidates and our incumbents to ask some basic questions that our voters want to know. And there are no shortage of groups who are involved in their civic duty to engage in the democratic process and ask questions of their elected representatives or those who hope to be their elected representatives. So while maybe some folks would like to say that we're part of some elaborate plot or scheme, what it really boils down to is we are really just a collection of concerned citizens. We are a grassroots group that is not taking any donations from anyone. This is all just volunteer time, and what we are spending is out of our own pockets because we believe that our government could be doing better. We are interested in hearing more of our candidates speak to the issues that thousands of Guam voters care about. And while we're not saying that the 6 issues that we bring up in our questions are the only issues that Guam voters care about, or even the only progressive issues, we do feel like they're important, substantive, and not just dancing around the edges of how we could make actual positive change on our island, but are actually pointing to issues that real voters talk about often, but we don't often see addressed by our elected officials.
So the deadline is this Friday to respond. And Julian, can you you said 3 candidates responded only thus far?
Two of them have responded with answers, and we appreciate that. And then one has committed to submitting something. I'm sure a lot of a lot of candidates are still going to get theirs in. It's just, that's what we have right now.
Okay. And so when the deadline comes on Friday, will the PDG then release the survey results and then also issue, I guess, the list of candidates that you guys endorse, similar to what the PAC did?
Yes. Well, I don't think the PAC, I don't think the Action PAC really released the results of the survey. They just released who they support based on the survey.
Yeah.
And we think that's an important distinction. We intend to be much more transparent, and we want to share what candidates answer because we believe that people are interested in what their answer is. Technically we're trying not to endorse anybody. We're trying to instead just sort of highlight those candidates that we believe have, through their responses and through their public statements before and their actual actions in the legislature, if they're currently or have been a senator, to basically get a sense of how strongly they are actually supporting our core issues, which are the 6 issues. And, then we're going to provide our own sort of evaluation, and that's about it. But we don't look at it as an endorsement.
Why not,
it's really
though?
just
I mean,
saying these guys align with our viewpoint, or they don't. Or if they don't, then, or if they're not as close, then we're kind of intending to leave a lot of people sort of ungraded, if you will.
Right. But why not just endorse people? I mean, what's the big deal? And then also, if you could give us some examples of, like, let's say, sitting incumbent, whether Governor Lou Leon Guerrero or, Congressman San Nicolas, or who are some Democrats that we currently have in office that you feel would be able to be labeled as progressive Democrats? Just to kind of give people an idea. Oh, like that person. Okay. Oh, gotcha.
Sure. I'll field at least the first part of that. Why not endorse? That's a great question, and something that we've spoken about internally. We don't feel like there's anything inherently wrong with endorsing, but we are truly a brand new organization formed just in the last few weeks to already have thousands of participating members. But we felt like, at least in 2020, our participation would be best if we just kind of slowly got involved and stopped just short of endorsing, because really our goal isn't to say that this person is good and this person is bad. We trust individual voters to make up their own minds, but what we hear constantly and what we concern that we share is that there's just not enough information. So at least for now, what we're really trying to do is bring attention to certain topics, ask substantive questions, and give candidates an opportunity to respond, to engage in this dialogue. So nothing against endorsing. It's just a decision that we as a group have made, and we're open to changing that later down the road. In terms of specific senators or office holders that we would deem quote unquote progressive, again, wanting to stop stop a bit short.
Wait, this is just funny to me, Tony. I mean,
I don't want to pivot. I'm going to answer your question, but sticking to policy. I think that we can look at certain bills that have been introduced that we would say, okay, that seems like an actual attempt at making substantial change while also honoring workers, environment, safety, and other being aligned with key progressive values. And one of those, something that personally caught my attention the other day is Sabina's introduced bill to look at ways of truly fighting the man-made wildfires on Guam. This has a cascading effect on the public health, on our economy and safety, and clearly, I've worked on this issue before with environmental groups here on Guam. A shocking percentage of the island burns every year, and that has terrible impacts that go beyond just blighted landscapes. So that would be one example of something that's been introduced lately that I would say, hey, that's great. We're finally addressing a problem that has just been lingering for years.
So is that an endorsement?
I think I answered that.
No.
I mean, I just think it's funny that we have a political action group that doesn't want to get political.
I wouldn't say that. Point taken, but I think that is missing the point just a little bit.
Can you let us know who are the two that actually responded, and the one that said we plan to?
Yeah. So far, our response, well, the first response was very early, but his responses are a little short. It's from Ken Leon Guerrero.
Mm-hmm. Oh, right.
And then yesterday, I got a response from, Joe San Augustine. And then Kelly Marsh Titano has committed to answering.
Mm-hmm.
So I'm not. We're kind of waiting on that one, and of course, we're waiting on everyone else for now.
Mm-hmm. What happens if it's just the three? Because it's 3 days away for the deadline to respond. Do you plan on extending it, or?
Well, let's take this opportunity to encourage anyone running for office to engage with your voters. Here's a wonderful opportunity. I'm sure you're all lamenting at the dinner table with your families that, man, if it wasn't for this COVID situation, we'd be out there shaking hands and speaking to people. Here's a great opportunity. And, if you want to sit this one out, fine. We respect that. But at the same time, guys, it's not too late. These are important issues. Engage with the people whose votes you would like to earn.
Mm-hmm.
Republicans included. I know it's a little confusing to have Democrats in the name, but I would like to put this out there. We've said it. We've released this information to the news media, but we are not going to be highlighting answers. We're not going to be giving preference to registered Democrats. We are looking forward to being surprised by learning that some Republican candidates might actually share 1 or 2, maybe 5 or 6 of our values. We are very open to building bridges across the parties. And the fact that the very first person responding was Ken Leon Guerrero is, I think, a good sign that there are opportunities here for folks to engage with us and find out that we might have more in common. That there are voters across the political spectrum, when you go issue by issue, are surprisingly progressive. Even a lot of registered Republicans.
I really took the Action Pack to task, talking about who comprises their membership and the obvious political leanings that territory comes with, and I kind of want to do the same with you guys. So, Julian, I know you're at Adelup. Which agency?
I'm sorry.
You're an Adelup staffer?
I'm not in the sort of political realm or whatever. I'm working within the Bureau of Statistics and Plans.
Yeah. So, I mean, when you're going to do, response from Senator Kelly Marsh Titano and her husband's your boss, I'm just wondering what kind of endorsement, not endorsement. And because I just feel like when you get an Action Pack, like, I want to know who's really behind it. And so that being said, I mean, are you guys kind of like an extension of Adelup, or are you separate and independent from the Leon Guerrero Tenorio administration?
We're completely independent. I work where I work. I can't really help that. I like my job. I like what I do. But it doesn't really enter into this. And beyond that, I'm certainly not making the decision myself. And we're constraining ourselves to focus on the issues rather than just going off of our feelings. So I feel like we're going to be able to do a fair evaluation for everyone.
Mm-hmm. There was something,
and
Tony.
There are a lot of folks involved in this that have no connection to GovGuam and Adelup whatsoever. I can say with full confidence that the governor and the current senators learned about Progressive Democrats of Guam forming and sending out surveys when they opened up their email and got questions if they're a candidate, or when they read in the recent PNC article that our group was formed. So there was no backroom consulting, dealing, or asking for marching orders, and there won't be.
Tony, I wanted to follow up on something you said about the formation of the PDG, in part due to unhappiness with the government, right? And so, the Democrats, they have the supermajority in the Guam legislature. What does your organization think of their performance?
I missed the last part. What is our organization? What?
Think about the performance of the 35th Guam legislature, the super Democratic majority.
Well, I think it's safe to say that it's a mixed bag. I think there have been many successes. I think that there have been some very excellent moments, but none of us are so partisan to just cheer for the team no matter how they're performing. We have definitely seen moments where we would have liked bolder responses, bolder reactions, or maybe a very, going in a very different direction. So I think we're cut from a cloth generally at Progressive Democrats of Guam that would be more in line with the sort of beliefs, values, and policy proposals that you'd see from someone, not only, but someone like a Bernie Sanders, right? And while I think that there have been some very good moments in the last few years with Guam's Democratic supermajority and governor, we certainly see room for improvement. And I think, we certainly saw room for improvement under the previous administration. And it's hard for any of us, I'm sure, if we're being realistic and nonpartisan and fair, to imagine any administration that we wouldn't want to see certain changes from.
Julian, did you want to respond to that?
Well, I'm not going to endorse everything in the legislature, but this is just for me, and we haven't really discussed this internally that much as to how the legislature is doing or anything like that. But I feel like a lot of, or several of our issues have been touched on, even if they're not fully enacted or whatever. The minimum wage has been or is still set to increase to $9.25 on March 1st next year, and we think that seems like a good thing. That's more or less in line with our desire to have a higher minimum wage. With unemployment insurance, Talina, it didn't really go anywhere, but Talina introduced a bill to provide some unemployment assistance. I'm not sure the funding was really there, but the intention was there, and I think that's a very good thing. At the State of the Island address this year, the governor unveiled a sort of initial plan to move forward toward universal health coverage through a system of public self-insurance, and we're not endorsing that, but we believe that's a good step, and it gives sort of a substance of something to pursue and to explore. So I feel like a lot of different things have been touched on, and as Tony mentioned, the environmental regulation on arson, that's a big issue too. Mm-hmm. So I feel like a lot of our issues have sort of been touched on to varying degrees, and so I feel like that it is a relatively open legislature for beginning to address some of the issues that that we have highlighted.
Right. So you guys talk about universal health care. You talk about the environment and the unemployment insurance. But what do you guys hope from this new batch of elected leaders? What sort of legislation are you hoping they will introduce that would improve our economy, though, and fight this pandemic?
You know, I would say fair compensation for essential workers. These folks are literally risking their lives and the lives of their loved ones in order to help us bag our groceries or take care of our loved ones. And it's even before the pandemic, I think sometimes it was hard, it can be hard to justify the low minimum wage. And now certainly with folks risking their lives and their families' lives with no additional compensation, I think it's besides good economics in terms of helping to get more money circulating in the local economy, it's also just a matter of principle and the right thing to do. We also want to see PPE for workers who are, not all, but many workers are forced to provide their own PPE out of their own pocket. And we feel like that's an expense that's hard to justify for folks. And that it would benefit all of the public's health if we can guarantee that anybody who is deemed an essential worker who needs to come into the office or into the sandwich shop or whatever today can feel confident that as soon as they arrive, they're going to get a fresh N95 mask and whatever else they need to keep themselves safe and their customers. There are so many things that we talk about here that have direct material economic benefits for the people of Guam. And I'll let Julian speak to this one, but certainly by cutting the BPT, which seems to be the number one issue for Action PAC, that is just going to have massive negative effects on the hardworking people of Guam. And this is certainly not a time to try to lay off hundreds and possibly over 1,000 more people. And just this trickle-down economics notion that by having a few companies save more money by paying less taxes, that's somehow going to lower the costs for consumers or is going to lead to massive investment and hiring. We just know from decades ago. That's not how it plays out.
What if I set up an Action PAC, Progressive Democrats, we get you guys on the same Zoom and just kind of go toe-to-toe on these issues? I think it would be great. You down?
Perhaps. I think so, yeah. But
I think that'd be really cool.
We're all about dialogue.
Yeah.
So if I could take just the opportunity, I think that right now unemployment insurance could do a huge thing. We do have the pandemic unemployment assistance, but right now that is set to expire on December 31st. So we don't really know what's coming next. The Republican Congress does not seem set to actually provide any sort of motion in the next month or so. Although it could change as people begin to see that it's really rushing up on us, and we're going to end up having a situation with a lot of people who are desperate and unemployed. But in any case, whether it gets extended or not, we need unemployment insurance. We've needed it for decades, and the fact that we don't have it is honestly kind of shameful.
Kind of mind-boggling.
Even a relatively small jurisdiction like the U.S. Virgin Islands has unemployment insurance and has had it for decades, like since the 1970s. So to me, I'm very passionate about that. I've been passionate about that for years. And anytime that anybody, would ask me, well, what would I do if I was senator or whatever? Unemployment insurance, absolutely. But I'm actually have no interest in running for elected office at any point in the future.
Okay, guys, we kind of got to move on to the next. But
I was just about to endorse Julian, though. I thought you wanted to endorse
finally an endorsement. No, we'll bring you guys on when you get your responses. And I want to set up that kind of like Action PAC and you guys, because obviously opposing sides of the spectrum. I love that kind of dialogue, and I think you know, when you're passionate about what you believe in, you know, and you're given an opportunity to defend it, then let's go.
Great.
Cool. Okay.
Well, thank you very much.
Thank you for the opportunity to
Of
speak
course.
on these important issues.
Right on. Julian, thank you.
Yeah, thank you very much.
Tony,
Take care.
thank you guys. Wash your hands. There you go. The progressive Democrats of Guam here on the link. It's the Breeze 93.9. We'll keep it moving in the KUAM News Zoom room right after the break. It's 7:24. Good morning, Guam.
Pepsi Guam Bottling, a local company. We produce your favorite products right here on island, like Pepsi, Mountain Dew, Hanum, Chamorro Punch, Tropical Ice, and more. We've invested millions into local production and will continue to upgrade our facilities and provide local jobs so you can truly buy local. Our long history of producing the freshest and best products will continue. This is our vision. Pepsi Guam Bottling.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Celebrate National Pizza Month with a Pepsi Pizza Report. Pepsi helps celebrate this tasty month with an easy way for you to win Pepsi and pizza. Post a photo of yourself enjoying your favorite Pepsi beverage to KUAM News, Uno Instagram, or Facebook pages to enter to win Pepsi and pizza from one of 10 pizza sponsors. Catch the Pepsi Pizza Report every Thursday on KUAM News The Link Morning Show and on the social media pages of KUAM News for reports, tastings, and everything pizza and Pepsi.
These are some of the signs that someone is thinking about suicide. Talking about wanting to die, excessive guilt or shame, and feeling like a burden to others. Feeling empty, hopeless, trapped, or having no reason to live. Feeling extremely sad, anxious, agitated, or full of rage with unbearable emotional or physical pain. Other signs include changing behavior, such as making a plan or researching ways to die, withdrawing from friends or saying goodbye, giving away important items or making a will, taking dangerous risks such as driving extremely fast, displaying extreme mood swings, eating or sleeping more or less, and using drugs or alcohol more often. If you or someone you know is showing these warning signs, get help as soon as possible. Call Guam Behavioral Health and Wellness Center's crisis hotline at 647-8833 or 4.
Your generosity can change lives. Disasters won't stop during this global pandemic, so neither will we. The Guam chapter of the American Red Cross is calling on the continued support of the community to assist with their mission of providing disaster relief and recovery efforts, military family support, and life-saving training and certifications. In times of emergency, our support will not waver, and we pray that your support of our efforts will continue as well. We invite you to join us in commemorating our 20th annual signature fundraiser virtually this year by supporting the Red Ball in a Box. We will be delivering special red boxes, which include a 4-course dinner from Micronesian Chefs Association and wine to our patrons and sponsors. As a sponsor, your company and message will also be featured in a special television tribute to the Guam chapter of the American Red Cross. For sponsorship opportunities and more information, please call 688-0280 or visit our Instagram or Facebook page. Let's support our community. Though we're apart, we're still together in generosity and support.
You're watching The Link with Chris and Sabrina on TV 11. Stick around because we're next on CBS This Morning.
We got your 6.
At 6 a.m. with The Link on Breeze 93.9 FM. Bree and I connect you with all the latest news and information you need to know to start your day.
Then check back with Guam's news leader at 6 p.m. for the day's top headlines with KUAM News Primetime.
From 6 a.m. to 6 p.m. and everything else in between with KUAM Digital, we got your 6. that was pretty interesting. I want to set it up, though, man, the Progressive Democrats versus the Action Pack. They didn't really seem too excited about that possibility, though, but I'm going to make it happen. You know what I mean, Bree? Yeah, I'm going to make it happen. Nothing like fireworks in the morning. 7:29, let's go to the K-Wave News Zoom room where it is looking very sunny in Tamuning. At the Guam Behavioral Health and Wellness Center, the director, Therese Ariola. Good morning, Therese.
Good morning. Good morning, everyone. Buenas and off day.
Wow, like I said, it's looking very sunny over there at GBHWC.
It's sunny here, but in Barragata, it's raining.
It's raining here in Harmon, too.
So,
yeah. All right, so we'll just get right into it. We had got a tip. I know I talked to you about it yesterday. About some positives at one of the cottage homes that Guam Behavioral Health and Wellness Center oversees. So if you could, Therese, give us some info on that. And I'm trying to find it on my phone, the tip that we had got. So I'll go ahead and tell you what we have after you tell us what you have.
Right. So it's
well, yeah, go ahead, Sabrina.
No, what we had got was an individual and her had tested positive Friday. The individual and her boyfriend had tested positive. They both had been sick since last weekend. Friday, she got word that her coworker tested positive, which prompted her to get tested. Most of her coworkers are positive, including one that is pregnant, which is 8 so far, and 3 clients they tend to at the cottage home who are all under 17. 2 of her coworkers are on lockdown in cottage with the 3 clients till October 13th.
So who's my reporter?
What do you mean?
Who's sharing you that information?
Oh.
Her and her boyfriend? I'm not sure who you're talking about.
Okay, well, regardless,
right?
it's an
the first sentence
employee.
is her and her boyfriend got sick last weekend?
Friday, tested positive Friday.
She is my, which one is my staff? Both of them?
The female.
The female. So, first of all, Chris, thank you for calling me yesterday. And, you know, I'm always willing to talk to KUAM. I've never said no.
Thank you.
So, yeah, no problem. It's, what threw me off yesterday in your conversation was you kept saying cottage home.
Yeah.
So when I think cottage home, I think of the Talafofo cottage home that the Lieutenant Governor and I are working on trying to get transferred to Guam Behavioral Health.
Right.
So it kind of threw me off when you said cottage home. So
Not bad.
we do have homes, for the record, at Guam Behavioral Health that houses individuals who do not have homes or need special care, or they have either as a child or children under 18, serious emotional disturbance, or adults, we call it serious mental illness. So we have several homes throughout the island, and we do have one home for children. And Friday, we were informed, it wasn't last weekend, and it wasn't a female. It was Wednesday. Apparently one of the staff, male staff, called out sick because he wasn't feeling well. And of course, the protocol is there are no MARTA working. You cannot be coming into work if you have any sign of the flu or so he did that. And he, of course, he went to get checked when he got checked and swabbed, they gave him a test. He was positive. He informed us Friday. And because he works in a home where we care for our clients, I immediately coordinated, and thank you to Public Health and for all the work that they do. I immediately coordinated with Dr. Kaneshiro and the nurses, the good nurses up there at Public Health Northern, to come into the home and do an entire testing, if you will. And we found out late or early Friday evening that the clients are positive, and most of the staff I had to coordinate for a Saturday morning, early morning testing. not sure who the 8th person is, but we do have 7 positives, staff positives. But the very good news is, and I'm hoping it stays this way, of course, is that everyone that we are in contact with are asymptomatic, which is threw everybody off. Nobody was sick except this one male. And it's unfortunate because it's that one male on Wednesday that was having symptoms that caused him to get the test, that caused me to set the testing for the entire staff and house. But unfortunately, he's just symptomatic. There are others who are asymptomatic, or everyone else is asymptomatic and doing very well, by the way. And so you don't know who brought it in. Was it the symptomatic person or the asymptomatic person? So the bottom line is everyone is doing well. The clients are doing well. They're bored because they're bored, and we're trying to get them to stay in their rooms and isolate. But in reality, the whole house is in isolation. And so we wish our staff well. They're all in quarantine, and we will be expecting them for an all clear testing before they come in. And so, the good news is that everybody is well.
Yeah.
So you said 7 positive staff. How many? You said 7 positive staff. How many clients?
7 positives, 5 negatives.
And how many of those
Right.
are clients and how many are staff?
And 3. No, that's 7 positive staff, 5 negative staff, and 3 positive clients. But they're all doing well and quarantining, isolating.
Right.
The positives need to isolate, and the negatives need to quarantine.
What are the age ranges for the positive clients?
16 and 9. 2 16-year-olds and 1 9-year-old.
And then, so Therese, what's the current status of operations at that particular facility?
Because they're asymptomatic, we continue to serve. We continue to help them with their homework and life skills and everything else on the daily basis. The home itself doesn't seem like anything is going on because everyone is well. I had to lock the home down because they're positive.
Right.
And I had to send everybody home to either isolate if they're positive or quarantine if they're negative. And so the operation of the house is ongoing. Actually, we have, the nurses at Public Health check on our clients and check on the home, the whole home. And then I have sent our Guam Behavioral Health nurses to check on them daily. So I get a 2 times a day report on how the house is doing. And as late as last night's report is everyone's doing well, still asymptomatic. And it was like day 3 yesterday? No, day 4. So they're doing well. And so the house is operational. The kids are still doing what they do daily. They don't, other than the fact that being told that they're positive, they don't feel any different.
So just to clarify, you have positive clients secured in a facility being monitored by positive staff.
Well, the best thing for these clients, because they're young, they are children under the age of 18 who are clearly with Guam Behavioral Health for obvious reasons, an emotional disturbance. The best rule of thumb was to keep them in the house so that there is no need for more adjustments in their lives. And so I made a decision Friday to lock the house down, to consider it a mini isolation, if you will, a mini isolation house for the sake of the clients, so that they don't have to feel, they don't need to be moved to Bayview. They don't need to be moved to the hospital. They're asymptomatic. I have my nurses checking on them twice a day. Public Health is checking on them twice a day. They have hourly, it's called a monitoring sheet for each one of them that they, They monitor, are they feeling any symptoms? Is there any fever spikes or any other symptoms, body aches, of those, whatever all the major symptoms. In other words, do you feel anything different today? And so monitoring sheets are happening. Our nurses at Guam Behavioral Health are checking the house to make sure that everybody's okay. Actually, the house probably gets more calls today than ever because you have every manager, senior management, nurses unit calling, and public health on top of that calling.
Right.
So there's a lot of people checking on them. The house is really self-contained. They get food. Everything's normal, with the exception of them being told they're positive.
So how many, are you able to tell us how many staff are isolating at the facility and how many clients? So it's 3 clients. And how many staff?
Right, and two are in the home, because as you know, there are our responsibility, and so we cannot leave the kids alone.
Yeah.
And so we have 2 staff with them all the time. And so, good. Yes, go ahead.
Oh, no. So there's 2 staff, 3 clients.
2 staff, 3. So there's 5 people in an isolation
Okay.
home right now.
Therese, what would the...
And they're all asymptomatic and doing well.
Nice. What would the protocol be if one of those staff took a turn for the worse? They started manifesting symptoms and you had to then maybe move them out of that facility.
Right. Well, the protocol would be that they would, because they're symptomatic, we would want to make sure that they are seen by a doctor.
Right.
And so the protocol would for them to go to their doctor or 911. With regards to the clients, the minute they feel sick, the protocol is call 911 and take them to the hospital.
Okay.
Our greatest concern and is, as you know, and every day, it's very, very disheartening to hear how there's so many deaths. And it's clear that there is no rhyme or reason or no age preference for this disease. And so it doesn't matter if it's a mild symptom that flourishes, we're going to take them to 911, to the hospital, and make sure that they're checked out. But for today, and maybe because of many, many prayers, they are asymptomatic. And as I mentioned before, other than being told that they have the virus, nothing has changed in the house. And I thank God for that.
How did you take the news, though, Therese, that... Because this is a big, it's big
very
piece
heavy.
of info, right?
It's very heavy for a director because they are my responsibility. And so I cannot even begin to stress enough to the people of Guam how contagious it is. Because one thing's for sure, and to be clear off the bat, is that Guam Behavioral Health has done everything in its power to prepare our staff for the protocols. I mean, I don't know where it went wrong. And I can see how nobody thinks, we don't even know who received the virus, really. Because when you're asymptomatic, you cannot, do you blame the symptomatic person? Of course not. Because they just happen to be symptomatic. But who's to say the asymptomatic person did bring it in, right? But Guam Behavioral Health has done everything, has provided, there is no need, there is no longing or need for PPEs, for cleaning supplies,
Right.
for constant reminders. I mean, I feel like a broken record every management meeting. I know managers are hounding. 100% compliance is necessary. Cleaning. I just can't emphasize to the people of Guam how serious this is. And as a director that is responsible for people in our units and in our homes, it's a very heavy responsibility. And I pray a lot. Well, people who know me know I pray a lot, but I've never prayed more since March. And I've always said that we have to be very careful. I saw a CNN report. Wouldn't it be? It would be very different on Guam or in the world if everybody had if we had a marking whether we're positive or not. I think people would be more careful. My concern is that because there's so much asymptomatic people going around, that people tend to not be as careful as they should be. And so I beg the people of Guam to not 100%, but 200% follow the protocols. Because if you and I were positive and we were in the same room and we were using our mask like the two of you are in the studio apart, even if the two of you were positive, you would not give it to anybody else or one of you because you're practicing those social distancing, the masking, and the washing the hands. So I think the washing of the hands may have gone away. I know they keep forcing, but it's the washing of the hands, because if one of you are positive, you would not get it, Sabrina, for example, if Chris was positive, because you're apart, you're masking. But what if you don't wash your hands and you touch like the piece of paper that Chris might have passed to you and he accidentally had some germs on it? That's when you would get it. So all of it needs to happen, not at 100%, but 200% compliance.
Right.
And so the Guam Behavioral Health will monitor our staff, will monitor our home, we'll do everything we can, bring them to the hospital if they become symptomatic or anything changes or feels different. And then the key would be for everyone to isolate for 14 days, and the virus will die altogether in the home, altogether. At that time, the home will have to be deemed all clear. We would come in with we have hired professional disinfecting companies to clean our satellite offices, clean our main facility, and then start from scratch, ground zero. So on day 15, 16, somewhere there, when we disinfect the house, then we would be on ground zero, everybody would restart. In other words, everybody will be clear and, and life goes on.
Right.
But right now at this point, we just try to keep the house to be normal as possible. And thank goodness that everybody is asymptomatic. And as I mentioned before, other than being told they're positive and the anxiety that comes with that, nothing has changed in the home.
Teresa, are you able to tell us what village the home is in?
In Tamuning.
Tamuning, okay.
And just real quickly, Therese, you said
Sure.
the seven positive staff, they just work at that one home, right? They don't go to any. Okay.
Okay. Has this prompted any effort on your part to further test any of the other staff at GBHWC?
Yes, only because of the because of the asymptomatic. Just yesterday, I'm looking into, and I'm going to be coordinating with Dr. Kaneshiro for testing from one house to another. Because again, we're always telling our staff, and they're really good about it, don't come into work if you're feeling ill. But what if you're asymptomatic?
Right, that's the problem.
So the great number of asymptomatic employees is a great concern of mine, and should be a concern for everybody on Guam. That just because somebody is not showing symptoms doesn't mean they're not a carrier of the virus. And so even more, we have to be concerned that the virus is a really silent virus that can penetrate our homes, our children, and our family members. And those we're responsible for. So the home, it's my responsibility. And it's very heavy. It's a heavy task.
What if something was to happen to one of the staff or one of the clients, Therese?
Then we all go through what is called debriefing. We all go through what we give the community, and that's the counseling support and the support. So right now, the Guam Behavioral Health staff knows that our services are open to them as well. You know, even just the whole anxiety thing. Right. Just because we work at Guam Behavioral Health doesn't mean that we are not like normal folks who don't feel the anxiety of the virus.
No.
The only difference is like public health and GMH and other essential health agencies, we're working through it. So we've never stopped working since March.
Right. What about the parents?
So
the parents of these children that are in this group home, have they also been tested? What kind of...
Well, these children are with us for various reasons,
Right.
and they have not been, they've been with us more than 14 days.
Wow, okay.
Okay.
Well, Teresa, our thoughts and our prayers.
Just leave it at that.
Right. Definitely going out to
Yes.
the kids and the staff and, you know, you and,
Yes.
and the
Thank
agency
you,
as well.
and I ask everyone to please be careful. Again, the number of asymptomatic people who are walking around with the virus is a very deceiving notion that they're well.
Right.
So that is why everybody is being asked, whether you feel well or not, to do the 100% protocols that is being asked of us. And with that, I just wish everybody well and can thank you for your prayers, and please continue to pray that all my staff and especially the clients that we're responsible of caring for on a daily basis, we continue to be asymptomatic and hopefully the virus will die after 14 days within the home and everybody will be clear. So again, everybody is doing well, and I can't ask for more than that, and I'm thankful to God for that.
Well, thank you,
Thanks,
Therese.
Therese.
Thanks for coming on.
Thank you very much. Everybody stay safe.
Okay,
Thank you.
wash
Stay
your
safe.
hands. I got to bring back wash your hands because you
Wash your
said
hands.
it went away. So wash your hands.
Yes, wash your hands needs to come back. I think everybody's got the mask down,
Right.
but the washing the hands.
Thank you.
Thank you very much,
You got it.
everybody.
Okay.
Have a good day.
You too, Therese. Esther. There you go, Teresa Ariola, Guam Behavioral Health and Wellness Center. The takeaways, Bree? Got staff and clients sequestered in a GBHWC. Basically, it's
Group
like
home
a
for
cottage
children,
group home,
yeah.
right? In Tamuning.
So 7 staff had tested positive. I want to say that's what she said. 3 clients, 2 16-year-olds, and I think she said a 9-year-old. A 9-year-old tested positive.
Right.
And so she locked the house down. So staff are staying there with these kids, and
It's
I
a hot
guess-
house. The whole house is hot, basically.
Right.
Hot meaning positive, guys. That's one of the terms I picked up from the surgeon cell. Yeah, definitely our thoughts and prayers. I hate saying thoughts and prayers, but you're definitely going on to that situation. Obviously, the directors, taking it to heart. It's a heavy burden.
Yeah.
I'm just really hoping for the best. And I was just going through that whole interview, Bree. God, I'm so sorry. Forgive me, Lord, but I kept hearing the clip with the lady asymptotic. Sorry, that's just me. Got to bring that one back. Let's keep it moving in the KUAM News Zoom room here, where we have Gayleen Cruz standing by. Gayleen penned a viral letter, and I'll just go ahead and read it to you guys before we bring her on here. Half a day. My husband was recently admitted to GRMC with life-threatening conditions. Due to COVID-19, policies have been implemented to prevent the virus from spreading. I understand these policies have been made to protect patients and staff from further exposure. One of those policies prevents patients from having visitors, which means they have to fight their battle without a loved one beside them. There needs to be a clear distinction between a caregiver and a visitor. The issue I have with this policy is not that my husband can't have visitors, but the fact that he's unable to have 24-hour assistance from a loved one, a caregiver. My husband has called me crying, due to the lack of compassion from the hospital, which discourages him from asking for help. When he was sent to the hospital emergency room by his doctor, he wasn't mentally prepared to fight for his life alone. Poor mental health is a potential risk for chronic physical conditions. I'm seeking assistance to help voice my concern for a change in policy. The change I'm seeking is a policy in which a patient may have a designated caretaker. If that means testing negative for COVID-19 and remaining with a patient 24/7 without being able to leave the hospital, then so be it. If hospital staff is able to come and go with the possibility of being exposed elsewhere, then there has to be a way to allow patients a designated caretaker. We need to rethink this policy and develop a humane policy. We can't allow our sick ones to die alone. It is just inhumane. And we'll bring on now Gayleen Cruz, who wrote that letter that we just shared with you. Gayleen, good morning.
Good morning. Thank you for having me here today. Greatly appreciate it.
We definitely want to get your story out. And let's just start at the beginning. Gayleen, the first question, what's it like not being able to be by your husband's side as he fights for his life at GRMC?
It's really honestly horrible. A horrible feeling to have your husband call every day, crying, begging for help, telling me he's in pain, begging me to come to him. I'm sorry, I'm just trying to keep my emotions tucked in. And his greatest fear is he's worrying about dying alone. The last thing the patient should be doing is worrying about being alone. They should be worrying about getting better. So mentally, this is taking a toll on both my family, my husband, and I'm pretty sure there are many families out there. And they need to differentiate between COVID-19 patients and non-COVID-19 patients. People are so focused on this COVID-19, they forget the non-COVID-19 people who are suffering. So if you don't mind, Chris and Sabrina, can I please read what my goal is here today, just so that I wrote it down, because my emotions, I don't want my emotions to get ahead of me. I want to make sure I accomplish my goal here today. If you don't mind, if I can
please go ahead, Gayleen.
I just want to make it clear that my goal today is here to open the eyes for our governor, lieutenant governor, political leaders, hospital executives, and doctor advisory board to open their eyes to the torture and inhumane policies that they are putting families through. It is unnecessary. It is critical that we rethink what they are doing, and I'm calling for a change in policy to allow caregivers, not visitors, but caregivers, to assist their loved ones who are critical illnesses and circumstances. I can talk about all the wrongs that happened to my husband, but I want to focus on a call for change in policy, to have them establish a caregiver policy. If they can put precautionary measures in place for businesses, airports, churches, schools, and then I don't see why it's going to be difficult for caregivers. Using COVID-19 as an excuse for everything is not cutting it. Today, that seems to be the excuse used to answer every problem and situations. People are quick to say, because of COVID-19. You have employees coming and going, getting exposed everywhere, wherever they go. They come to work, they enter the hospital, they get basic screenings and allowed to enter the hospitals. Why can't this be done for caregivers? Caregivers are more likely to take extra precautionary measures because the last thing they want to do is to get their loved ones sick. Our main focus is to be there to assist and take care of our loved ones, and the last thing on our mind is going anywhere. Thank you.
Thanks, Gayleen. Have you shared that letter? I mean, have you sent it over to GRMC or any of our elected leaders, or is this the first time you've read that?
I gave that letter out to every senator, the lieutenant governor, except for the governor. I didn't have her email, but I gave it to GRMC, former Senator Francis Santos.
Yes.
I gave it to anyone, all the news, everyone who would listen, about how inhumane this policy is. And it's not difficult. In the United States, there are many hospitals that are allowing caregivers not visitors. I understand, not visitors because of COVID-19, but I think they're being a little over paranoid. You know, the virus has been here since January. It's going to be here. Are we going to keep locking our caregivers out from our loved ones? Are we going to keep separating them? It's just horrible.
Have you gotten any sort of a response from any of our elected leaders regarding your letter?
Yes, Miss Tina, Senator Tina Munoz Barnes is the first one to call me and reach out to me. There's Will Castro and Terlahi who responded to my emails. Francis Santos called me personally. Lieutenant Governor has responded to my emails. Just basically saying they're gonna try to see what they're gonna do. But you know, time is running out for me. My husband has a major surgery on Thursday that's gonna change his life forever. And I need to be with him. People don't understand. You can have FaceTime, but that doesn't cut it. You know, we're humans. You need to be able to hold your spouse, comfort them, especially when they're scared. Especially when they got devastating news that's going to change their life forever. There has to be doctors out there for the Doctor Advisory Board who can put their heads together, and the senators and everybody have a little compassion. Families should not be going through this. It's unnecessary.
How long has he been at GRMC?
He's been there since last week, Monday. But my husband was in and out of the hospital in April and March. And, you know, the second time he went in was March when we had the first lockdown. And we had a devastating, really, really hard time. He didn't want to go to the hospital. That's the last place he wanted to go. And I'm pretty sure there's a lot of people out there who are very sickly who just don't want to go to hospital because of this situation. And they need care, but they don't want to get care because they don't want to be away from their families. You know, so unfortunately, he had to go in. It was directed from his doctor. It was a life-threatening matter. And so he had no choice. And I tell you, when we went to GRMC, he was crying. He really, really didn't want to go. He said, "I'm going to die." That's his words. "I'm going to die."
So you've been going through this for a week now, and nothing has happened. You've been asking to be by your husband's side for over a week.
Yeah. In a week, he's been through several surgeries already. He's been through a lot during this 1 week. So much that it's going so fast. Put your shoes on the patient. It's going so fast. He's incoherent, doesn't really understand what's going on. Things are just happening, surgery after surgery. He keeps going in for now he's on dialysis, and he's never been through dialysis. So this is a scary thing for him. And so, you know, it's just upsetting that when the doctor gave him the devastating news, nobody was there with him. When he called me, I was really surprised. I even called the hospital asking, why are they not calling me and telling me what's going on? I'm his wife. I had authorization. What is going on that you people are telling a patient this by themselves? Just imagine if they told you had cancer, or they told you have to cut your breast off or something like that. Imagine that kind of news, and then the doctor and nurses leave the room and leave the patient alone. There's so many things that go through your head. You know, that's why there's high rate of suicidals. The people are psychologically having anxieties. People are dying from these cases because they're not handling the situation right. You don't just tell somebody, "Oh, you have a life-changing," give them devastating news, and then walk out of the room and thinking they're going to be okay. Having FaceTime is not the same as being there to hold your husband, to comfort them when they're scared because they just got devastating news. And then you're telling him on Monday, I asked him, when is the surgery going to be? Oh, they're not sure because they have to have it consulted with orthopedics or someone else. The next thing you know, that same night, my husband calls crying because they told him his surgery's on Thursday. Nobody called me to tell me, at least tell me first so I can break the news to him. He's distraught. He keeps saying, please don't let me die here alone. Just to hear family, your loved one, your husband say, don't let me die here alone. He shouldn't be worrying about dying alone. He should be worrying about getting better. And I don't see, it's not going to cost the hospital anything to allow me to be there with my husband. In fact, I got a response from the hospital executive because I was upset and I had a lot of concern. Her response to me was, nurses are working 40 to 60 hours and they are tired and still come to work. She's being defensive. I understand it. I have no problem with nurses. Nurses are greatly appreciated. However, this proves that why we need nurses there. Why we need caregivers there. The nurses are not able to get to my husband on time when he needs the restroom. When he needs it, my husband is bedridden. He cannot move. He cannot, because he has, like I said to his, I want to keep it personal because I want to respect my husband, but he's bedridden. He can't get up. He can't do anything. So imagine you're laying there, you're helpless, you're pressing the buzzer, nobody's coming for some time because the nurses are overwhelmed. They have so many patients. They're running around back and forth. They have to get patient to patient. Having a caregiver there would eliminate that problem. If I need to get him a drink, I'll give him a drink. I need to take him to the restroom, take him to the restroom. I need to clean him up, I'll clean him up. Whatever it takes, the caregiver's there to eliminate those stresses from the nurses. And you know what they're doing? They're putting patients in diapers just because they can't get to them. You know how humiliating that is? You're talking about a grown man who was physically able to do things before. Now it's not. And you put him in Pampers. That's humiliating. And they're only doing that because they can't get to the patients on time. If you just have a caregiver there, the caregiver can take him to the bathroom, can help him, get him whatever he needs. I don't understand why the hospital is making patients suffer. They're torturing patients like this. Doctors and nurses are in the business of helping people get better and making sure they see success cases. But in this case, they're not. They're making things worse. They're not being compassionate. And of course, that's why I honestly think that's why a lot of people are dying. And this COVID-19, people are so focused on the people who died from COVID-19, they're not focusing on the non-COVID-19 patients who have died alone. There are many families out there who are experiencing this, and it's unnecessary stress. You shouldn't, it's not hard to designate one person. I've been with my husband for 30 some years. My husband has been sick since 2000, going in and out of hospitals every year, all year long. I have been with my husband. I am the only caregiver. I'll tell my 3 sons, it's okay, I'll take care of him. He's my husband. My husband needs me. I have never left my husband's sight. We made vows, and I'm up keeping my vows. No matter what it takes, it's just upsetting. It's causing stress to the person on the other side of the line, which is me, which is also there's 3 sons crying because we can't be there for him. He's suffering from so much pain. And all of this is going fast for him, like I said, 1 week. And he's been through so many surgeries, and then now he's being told Thursday is a big surgery. It's going to change his life. He's going to have to learn how to do things on his own, in a different way. He's going to see himself in a different way. Imagine that. You wake up one day and you're missing a body part. And you have to look at it. He needs me emotionally. He needs me physically. He just needs me to be there. And I don't see why we have to beg the hospitals, our leaders, for something like this.
Galen, we know at Guam Memorial Hospital, we talked to Lillian that they do make certain allowances for caregivers. I'm not sure why they don't do the same at GRMC.
And they allow visitors.
Yeah. I just want them to understand caregivers are different from visitors. We're not there to visit. We're there to care for them. We're not there to say, hi, how are you, and all that stuff. We're there to care for our spouse, our father, or mother, no matter what it is. Patients should not die alone. It's inhumane. And I'm pretty sure all these doctors and lawmakers and everything are very intellectual, that they can come up with a policy. If the United States can do it in certain hospitals, I don't see why they can't do it here. Having a caregiver there can eliminate a lot for our nurses who are exhausted, like she said, working 46, 60 hours. You know, we can help. And if I have to be in that room locked down with him, I'll say, anyways, that's what I do when I care for him at the hospital. I stay in his room and I watch him and I tend to him. It's just upsetting that they can't come up with a caregiver policy. And you know, I don't take no for an answer. I don't take this COVID-19 as an excuse. People are so fast to say COVID-19, COVID-19. We get it. We all understand it. We know it. We're practicing. We're wearing masks. We're washing our hands. We're social distancing. We're doing everything that we can. And as caregivers, the last thing I want to do is make my husband sick. So of course I'm going to take extra precautionary measures. We don't even go to anybody's house for dinner or anything. We don't go anywhere. That's how serious we take this as a family. I have a grandson that lives with us. My husband, the last thing I want to do is get any of them sick. You know, so the only thing that I usually do is I go get groceries. That's the only thing. I pay everything online. I do all my errands online. And I always make a list when I go groceries so I can get it one time and don't have to go back. You know, I don't see what is just so hard for them to see this. Families should not be going through this at all. People should not be dying alone at all. And I'm talking for non-COVID patients. My husband is a non-COVID. He took the test. He's negative. I'm pretty sure if I take the test, I'd be negative because we don't even go anywhere. We don't even do anything. It's just, I don't know what to say. Yes.
Yeah. Galen, we thank you for coming on and having the courage to share your story with us. I mean, every day there's just another heart-wrenching aspect of this pandemic. And you're right. I think we forget that there are many sick people who don't have COVID-19, who are in this similar situation. And I mean, I know GRMC's listening. I know the governor's listening. I know they're all listening. So in closing, what do you want to say to them?
I want to say that hospitals are doing more harm than good to the patients. I'm pleading with all governors, the governor, lieutenant governor, lawmakers, hospital executive, doctor advisory board, to please reconsider this policy, distinguish caregiver from a visitor. Let me please be with my husband, who's having a major surgery this Thursday that would change his life forever. He needs me. I'm willing to do whatever it takes to be with him. He needs all the support, especially after the surgery. His life will change. He will need to relearn how to do things differently, and he would also look at himself in a different way because of his condition. I'm fighting for my husband. I'm willing to have if all of you have a drop of compassion, let's not let this virus become blinders. And I say it again, let this virus become blinders. We are people, we deserve better. No one should ever go through this. It's inhumane. No patient should ever be worrying about dying alone. They should be concentrating on getting well.
Galen, we're going to bring on Father Paul Goffigan and Father Richard Kidd onto the Zoom with you. They were standing by. I know we're going to catch up with them on the masses, but Father Paul, Father Richard, Is this a kind of a situation you guys hear about a lot in the community where we have the people who are sick, whether it's COVID or whether it's not? I mean, it's not just the patients struggling with the isolation that they're dealing with, it's also their families.
What, Father Paul, you want to say something?
I totally feel for Gayleen and her situation. One of the things that I really miss is being present, especially visiting our visitations to the sick. And these are non-COVID persons. Right now, our protocols state that we can only go and anoint the person. But you know, we as priests always try to reach out, especially to those who are bedridden, to those who are homebound. And at this time, we cannot go because of the situation. I totally agree with Gayleen and in having a policy for caregivers, because again, we're becoming too paranoid. I think I was just thinking the other day, we're becoming like monks in the sense that, you know, that show Monk, where we're just becoming a bunch of germaphobes, and we're forgetting about the humanity, and we're forgetting about the whole healing that someone's presence can give to somebody else. It doesn't necessarily have to touch, but just to be there, just to be present with them, especially during their time of suffering, especially during their time of darkness. And I can, you know, I'm still reeling from the emotions that are within me just listening to Gayleen's saga with her and her husband, and just trying to be there. And then, like she said, it's inhumane to allow someone to die alone, and that is really something that we need to think about.
Paulie Richard?
It was just Mrs. Cruz, we're praying for you, and we're praying for your husband.
Thank you so much, Father.
I have to admit that this, as you were telling your story, I actually was talking with another wife yesterday, later in the afternoon. She was expressing the same frustration. That's exactly what's the issue with her husband, but his is more dire in the sense that he's actually currently dying, and you know, you can see for her it went from frustration real quick to distraught, sad. I wouldn't say that she was you know, one of her relatives kept saying, you know, calm down, that everything will be okay. But you can only say that so much. You know, Father Paul was right. And, you know, listening to your situation and the individual that I was counseling the other day, the emotions are real, and they're very, very high. I mean, I can only imagine. I don't have a family member that is in the hospital right now, so I can't say that I know for sure exactly what you're going through. But the stories that I've heard, you know, Chris was trying to get me on last week, and then tried to get me on yesterday, but I couldn't, because immediately after Mass, somebody said, I really need to talk to you. I don't know what to do. There's only so much comfort the medical professionals or scientists can give. And there's only so much words of wisdom and calming statements and peaceful statements from family and friends. There's only so much that can do. But the physical presence, and we as priests as well, we feel that when we're caught between a rock and a hard place, when the family members say, can you please come to the hospital? And well, depending on the situation, sometimes we just can't. But I can imagine even more with you, with your family. And I don't know how many other individuals in your household are also affected by this absence, by the separation. I mean, I think we can all acknowledge that there has been time, you know, in the past. We know when a loved one leaves off island in the military or relocates for job reasons. You know, those are things that we can handle. Well, we will see them again. And especially when they leave and there's no heavy burden on their shoulders. But this is not the same. And I've heard many people try and equate the two. I said, don't talk about separation of loved ones who are off island to loved ones that are here. They're just down the street in the hospital bed and they physically can get there. So I've heard many a story. You are not alone in this. Most definitely, you're definitely not alone. And I'm sure if others are watching this show today, your words brought them some hope. Your words, I'm sure, very sure, have brought them some comfort that somebody is speaking out. And thank you to KOAM for being able to air this out for further discussion. But in the end, it's the powers that be that will need to make the decision. But this is all we can do with this platform that we have. And of course, with all of us praying that all that happens will be for the good and God's will.
I think there's a little more that we can do, Polly Richard. Father Paul, if you could just lead us in a prayer for Gayleen and also for just the sick and afflicted on this island and their families. As you said, this is not a story that's unheard of. We've heard about these types of situations throughout the pandemic. So if you could, Father.
Sure. In the name of the Father, Son, and Holy Spirit. Almighty Father, your word tells us in Psalm 23 that even though we walk through the valley of darkness, we will fear no evil because you are there with your rod and your staff that will give us courage. We ask you to look upon us, all of us in this world. We ask you to look upon all the families who are suffering. We ask you to look upon Gayleen and her husband and just the very presence that they're not allowed to have. We ask you to give them the grace and the courage to go through this darkness and to know that you are always with them, step by step, with them all the way, and to give her husband the courage to know that and to know that he is being thought about, he is loved by many, that we are praying for him to recover. We ask you to give us your grace. That's all we need right now, dear Lord, your grace and your healing and your presence. We ask this through Christ our Lord. Amen.
Amen.
Viva Santa Maria Carmelin!
Viva!
Thank you, Gayleen. Again, thank you so much for sharing your story. We prayed over it, and we just put it in God's hands and hope for the best with his guidance. Okay, Gayleen?
Thank you so much. Thank you guys for having me. Thank you.
Of course.
Thank you, fathers. Thank you.
Fathers, we're going to go to break real quick, and we'll come back with you guys and catch up on the weekend masses and what we're looking for this weekend with indoor masses at the church, okay? Okay. We'll be right back. It's The Link, again, proudly brought to you by Carrier, Cabo Enterprises, and IT&E. This is The Breeze, 93.9. Good morning.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Pepsi Guam Bottling, a local company. We produce your favorite products right here on island, like Pepsi, Mountain Dew, Hanum, Chamorro Punch, Tropical Ice, and more. We've invested millions into local production and will continue to upgrade our facilities and provide local jobs so you can truly buy local. Our long history of producing the freshest and best products will continue. This is our vision. Pepsi Guam Bottling.
Your generosity can change lives. Disasters won't stop during this global pandemic, so neither will we. The Guam chapter of the American Red Cross is calling on the continued support of the community to assist with their mission of providing disaster relief and recovery efforts, military family support, and life-saving training and certifications. In times of emergency, our support will not waver, and we pray that your support of our efforts will continue as well. We invite you to join us in commemorating our 20th annual signature fundraiser virtually this year by supporting the Red Ball in a Box. We will be delivering special red boxes, which include a 4-course dinner from Micronesian Chefs Association and wine to our patrons and sponsors. As a sponsor, your company and message will also be featured in a special television tribute to the Guam chapter of the American Red Cross. For sponsorship opportunities and more information, please call 688-0280 or visit our Instagram or Facebook page. Let's support our community. Though we're apart, we're still together in generosity and support.
Battling COVID-19 is an unprecedented global challenge. To get communities around the world back up and running as quickly and safely as possible, public health authorities are building smartphone apps to help with contact tracing. Contact tracing is one of the best ways to stop a virus from spreading. It can take thousands of disease investigators to alert everyone who's been in contact with people who've tested positive. But even if disease investigators do their jobs perfectly, alerting the people a COVID patient doesn't know or can't remember is incredibly difficult. Smartphone apps that public health authorities build can help people at risk of infection get notified much more quickly. But a contact tracing app works best when more people download it. And being asked to download an app without knowing how it will handle your personal information might cause people to worry about their privacy, and they may not feel safe participating. That's why engineers at Apple and Google have been working together to make public health technology that protects individual privacy, so that people never have to choose between their privacy and the health and safety of their community. You're probably wondering what that means and how that all works, and we're going to walk you through it in a second, but first let's be really clear about a couple things. First, apps using this system cannot track your location. And second, this system does not share your identity with Google, Apple, or other users. Here's how that works. For every phone that's opted in, our technology disguises your identity by generating a random sequence of numbers that change every few minutes. Then, using Bluetooth, anytime your phone detects another phone close by that's also opted in, the two exchange those random numbers. If in the future someone's positive for COVID-19, they can report that positive result in their app. Any phones that had exchanged random numbers in the last 14 days will receive a notification that they may have been exposed to COVID-19 without revealing their identity. Public health authorities can then help anyone at risk get testing and treatment. But it's up to all of us to help with contact tracing. Do your part and look for your public health authority app that uses this exposure notifications system. The more people who participate, the sooner we can beat COVID-19 and get our communities back on their feet.
I cancel COVID.
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 By always wearing a mask.
We're staying 6 feet apart.
By staying active, eating good, drinking lots of water, and taking all my vitamins.
You don't want to be a part of the problem, do you?
I actually don't want to be a part of the problem.
Then it's time to do your part, Guam. These small things make a big difference in our community.
Because I want our Manumku to be safe and to protect them at all costs.
Because I am a nurse at GMH and I don't want to watch any more people struggle to breathe.
So that I can have students in my classroom again and that we can go back to normal.
Because our students are losing on valuable mentorship and social interaction that comes with in-class learning.
Because I passed it to my dad and I don't want anyone else to feel that type of guilt.
I wouldn't want this to extend for any surmountable time when this virus can be controlled at a community level.
That's the link, Miss Salad 827. It is the link, broadly brought to you by Carrier at 647 Cool, located behind Kmart, Cabo Enterprises, ITNE, and the Thrive Coalition, where it takes a village to raise healthy and drug-free youth. Thrive with us. As we just wrapped up a heart-wrenching interview with Galen Cruz. Before that, we heard from Teresa Areola, the director of Guam Behavioral Health and Wellness Center, the revelation that there's a Tamuning group home that has been hit by COVID. Teresa saying basically This home has been locked down, and everyone in it is COVID positive. There's 3 clients.
3 clients, 2 16-year-olds, 1 9-year-old testing positive, and then the 7 staff members, staff that tested positive. And so they have locked down the house. She said 1 was symptomatic, and then the others were asymptomatic.
Right.
And so they are monitoring the situation. If anything develops, I guess they'll determine what they have to do from there. And it's just a sad situation there. And of course, Gayleen's story, whose husband has been in the hospital for about a week now.
Right.
And he's having a major surgery this Thursday. And really all she wants to do is be by his side. And hopefully leaders will establish a caregiver policy. And GRMC is the non-COVID hospital, and her husband does not have COVID.
Yeah.
So she's written a letter to the governor, lieutenant governor, to all of your senators, and is hoping that there will be some sort of a change to allow people like her the ability to be by their family member's side.
Yeah, and it's not just her. There's a lot of people, as we heard, and we'll bring on Father Richard, Father Paul again. As we heard, this is unfortunately an all too common story during the coronavirus pandemic. And we'll bring on Father Richard, Father Paul, to kind of catch up on the indoor masses over the last weekend and what to anticipate for this weekend. Good morning, Paulies.
Morning.
Good morning.
Let's just go ahead and start with Father Paul. So indoor masses, green lighted. What were your services like over the weekend, Paulie?
They went very smoothly, considering the Liturgical Commission tightened up a few screws with our protocols. We now have the lectors wearing masks while they're reading, and everybody really has to wear a mask except for the priest. Until he goes and gives communion. The priest has to sanitize, especially after they have given communion by the tongue. But I think I only got a couple of phone calls or even pictures about some lay ministers not following the protocol. And of course, we understand some of them didn't even read the new protocols. So we just need to remind the pastors to really update. A memo was sent out to all of our lay liturgical ministers. Those are people like lectors,
right,
or altar servers or Eucharistic ministers about the new updated protocols, and to make sure that they got the info and to make sure that they are doing their part to keep everybody safe within the church. So it went pretty smoothly. And I was looking at it, considering social distancing, our church at Jigo was pretty full, considering social distancing. And I was looking at it and I said, we can fit everybody that was in that church on one side and fill up half of the pews on one side. So that's about 25%. So even though the policy is 50% capacity, believe me, we will be lucky if we fill, even 25%. So I think it's more realistic that way.
Father Richard?
Mine went pretty well. I actually had 3 masses this Sunday. The first one was kind of the main mass. It was the 8 o'clock mass, where most people go. I think we were full to capacity based on the protocol and social distancing. And those that couldn't fit inside the church, we have 2 20 by 20 canopies in the front of the church. So the folks went outside. And then those that couldn't fit under the canopy were parked in their cars. And if you've ever been to Santa Rita, we don't have much of a parking lot. The roadside is our parking lot. And I honestly didn't realize how far the cars went parking down the street until the deacon who went outside to distribute communion. I was trying to figure out why he was taking so long. And I stood there at the altar just kind of waiting. I said, he'll be back in like a minute or two. And, 2 minutes went by, 3 minutes went by from us. And where's this guy? And I started thinking the worst. He fell. Is this an older gentleman? I said, probably fell. I said, it's still wet outside. And then here he comes walking in. And after Mass, he says, sorry, Father, it took real long. I didn't realize that when I turned the corner, the cars went all the way down. I'm like, oh, okay, that's folks came out. They really did.
Yeah.
And you can see, we provided the 3 opportunities. If you feel comfortable to come in, you're welcome to come in. If you're not, you're outside in an open air space, and you're still social distancing. So there was those people could meet halfway, I guess. And then there were still those that just wanted to remain in their vehicles and watch us on Facebook Live and YouTube Live. And so that it worked very, very well. So that was my English Mass. I had a Mass at 10 that was in Chamorro, and I thought to myself, man, well, if it was that crowded at 8, I don't think there would be a crowd at 10, but I was wrong. The church was full in the inside to the social distancing and minimum capacity that we were given. So then I had an 11:30 that was in Latin, and I thought, for sure, this is it. No one's going to come. But, oh yeah, trust me. By the time I get to that one, I said, I don't know what language I'm speaking. I went from English to Chamorro, Latin. The old saying, you put the wrong emphasis on the wrong syllable. That was kind of me. I didn't know what I was speaking at there. But even that Mass had a fair number of people. We weren't. It wasn't, of course, as full as the previous 2 Masses, but people still came out, and all 3 there were still people in the parking lot that chose it. But we went. Someone asked me, "Are you prepared?" I said, "Well, we've been prepared. As I think Father Paul mentioned it last week when you talked about it. We've been prepared. So I think we had one of the more stringent. We put on ourselves some really strict protocols that to be followed, and our folks were ready. The minute they heard the news, they just said, "Father, everything's still sitting on the table at the back of the church. The wipes, the sanitizers, the alcohol spray. We have a team of dedicated parishioners. Right after Mass, they clean. And in the case of my weekday Masses, when I first moved to Santa Rita, I thought this was just wonderful. The people themselves, some of them brought their own disinfectant wipes, and they themselves, without waiting for the volunteers, they just wiped the seat that they were in and then got up and walked out. I said, well, so even they know. They don't, we don't have to be told. I think the when it comes to being sanitary, I think most people have the common sense to know, cover your mouth, wash your hands. Most, I've seen some that don't, especially those who have no problem, digging their nose in public and then shake someone's hand. Well, there are those people that exist, we know that.
Yeah.
But I think for the most part, most people get it. They're not gonna purposely, even outside of COVID. I don't think I've ever had a parishioner that purposely came to church when they had the common flu, And you were talking about, who was it earlier that was talking about using the word asymptomatic, and it's true. We don't really know. I can take temperature readings from, all 90 people that walk inside the church. Oh, by the way, I have a very high capacity, so 90 is still okay. I can take the temperature of all 90 people that walk in the church, and they can all be completely fine. But what if they're all asymptomatic and nobody really knows? Yeah. So, but yeah, I thought it went very, very well.
Was there a sense of validation at all in that, we had fought so hard to allow for these indoor Masses, and then when you had the turnout to be what it was, Father Paul, was there a moment where you were like, thank you, Lord?
Oh, definitely. We've always believed that we could do this. We can definitely open the doors for our people, have Mass, and still be safe. We've always done that. We've always been ready. It's just a matter of really getting the government to public, working with public health. And I have to say that they are very, wonderful people to work with, to listen to us. And I think that as we get more into this pandemic, maybe the governor would allow all of the places of worship to have to sit at a table to discuss with her just how essential we are to our people. Now we're really finding out that there are a lot of people out there who need people to talk to, who are having issues, who are thinking of committing suicide. This is part of the side effects of the pandemic that we're just now dealing with, when we should have been dealing with this all along, side by side, not just with the virus itself, but the effects that the virus produces, the emotional, spiritual, psychological effects that the virus is producing in our people. We cannot forget about that.
Are those the conversations you've been having, Father Richard, with some of your parishioners?
Yeah, actually, not just my parishioners, but folks throughout the island. And that's a good part about social media. I mean, if folks know that a parish has like a Facebook account, for example, they just click on send private message, and some of us actually have it on our phones, and it's not just a layperson that's running it. So I've actually fielded a few calls from folks that aren't anywhere near my parish. Yesterday, the wife that I was talking about with her husband, who is currently in GRMC, who was just she wants to be by his side because she honestly thinks that this might be the end. He has some underlying health conditions, a non-COVID patient, obviously, and spending some moments just to listen, because the majority of the time there's nothing much else to say, but just the ministry of presence, having somebody by your side to be able to talk to and pray with, because I basically prayed with the entire family. It's all over. Jigo to Marisa and everywhere in between. We have had calls. As a matter of fact, that yesterday where I wanted to call in at 7:00, I couldn't, because right after Mass, somebody asked me, I really need to speak to you. I'm going through something, and I spent a little while. We were social distance, but it was just something that I could have said. I'm not going to say no. I can't minister to you because I can't spend time with you beyond 15 minutes when you're obviously distraught. You're crying, and what you have to say, well, that's going to require a lot more unpacking and unfolding than here's 15 minutes. I think McDonald's, their current line right now, you can probably stay in line for about 10 or 15 minutes and enjoy your meal after, but this isn't a drive-through. These are people's lives, people's emotions, and nobody's giving them any answer. So what are we to do? This is exactly why Father Paul and I were ordained, is not just doing our priestly duties in regard to the sacraments, but it's also in regard to spiritual direction and lifting people up, and just reminding them of the hope of the resurrection and the power of prayer and the grace that is all around them. And it's not that they forgot about it. It's just that you can take a cheery person, and when something bad happens in their life, the good positive things around them seem to be just darkened, and sometimes darkened so much where they can't see anything else but that major issue. And it's helping them to unpack that, open things back up, open the windows back up from the room that they've kind of put themselves in because of this really high depressing emotion. Is they do need somebody, and in this case with mine and Father Paul's ministry, is helping them to open up,
let the sunshine in, right?
Yeah.
Father Paul, we gotta move along. So sorry, but again, the protocols, you talked about new protocols that come down from the Archdiocese. Maybe if you could what is the specific protocol for communion? Just for people wondering, I know that's the one part of the Mass where there was a lot of discussion about the possibility of transmission or exposure to the virus. So how have we tightened it up? And when we go to Mass, what is the proper protocol so that people know what to look out for?
Oh, I'm glad you asked that question, Chris, because some people are confused. Some parishes or some priests will not give communion by the tongue. They will only give by the hand. But we stressed this very firmly with our clergy the other day, that we cannot prevent someone to receive communion by the tongue if they want to receive. This is why the priest who's going to be receiving communion or going to be giving communion, or any Eucharistic minister, needs to make sure that they sanitize their hands before they even touch the ciborium, make sure that they wear their masks. And if you give by the hand, and if you try very hard not to touch the person, what if you do, if you touch any part of the hand, then you need, if you even think that you touched the hand, you need to purify, and then you need to sanitize. By the tongue, if someone was to receive by the tongue, you must give the person communion by the tongue, and you must, regardless of whether you touch the tongue or not, regardless, you have to purify your fingers and then sanitize. The reason why I say purify is because we believe that the host is the real, true, substantial body of Christ. So we are not going to sanitize Jesus. We're going to, the reason what we purify, the act of purifying of our fingers is to make sure that we put any kind of particle that may be on the tips of our fingers can go in this bowl with a purificator, and then this purificator is washed in what we call sacrarium, which is a sacred sink in the sacristy. And we say that's aquarium because it does not go into the sewer. When we wash it, it goes right directly into the ground. So that's what I mean by purifying. We need to, make sure we get rid of any particles that are on our fingers, purify, and then sanitize using the sanitizer. So that's how we're supposed to receive communion. And we're telling people, and I tell people, if you're going to receive by the hand, please make sure that you put your palms up flat so that the minister can gently put the body of Christ onto your palm without touching you.
Right.
Don't give us a cupped hand, and definitely don't give us, don't grab Jesus, okay? Just allow us to place
Don't you be grabbing Jesus now, because somebody's going to grab you.
Let Jesus be, okay? They already grabbed, our first pastor already grabbed Jesus, grabbed God from the tree of the tree plant.
Right.
So don't grasp Jesus. Just allow the Eucharistic minister to place the body of Christ on your palm safely, and then you can communicate Jesus into your body.
Yeah, don't grab Jesus.
The other thing is,
let him grab you.
We ask them to make sure they take off their masks before they come and consume. Okay. If you're going to receive by the tongue, and this is really funny, but it's not. If you're going to receive by the tongue, please don't give the Eucharistic minister a waterfall tongue, meaning you get out and then your tongue is like flat down, like a waterfall. It's because what's going to happen is the body of Christ is probably going to fall to the ground. Don't give us a cave where you just open your mouth and no tongue. And so we have to slowly put the body of Christ into your mouth without touching you. And so stick out your tongue straight out so the body of Christ can be placed gently on your tongue that's out there.
Thank you, Father Paul. Thank you, Father Richard, for your time this morning. I know that was longer than a 15-minute after Mass counseling, but I mean, I'm telling you, the words you spoke to Gailey and the prayers that you guys prayed over us, definitely worth every second of airtime. So thank you.
You're welcome. God bless you guys.
God bless you too. Wash your
Stay
hands.
Yes.
No
Yes,
waterfall
sir. Wash your
tongues.
hands. God bless.
Okay. All right, 8:46. Got to move along real quick as we got our Decision 2020 segment coming up. We go down to the Thrive Coalition, which is proud to present this next segment on the link, The Breeze 93.9. The Thrive Coalition, our partners, reminding you it takes a village to raise healthy and drug-free youth. So come on and thrive with us. And we're bringing on here as part of our Thrive segment. She's the clinical program director for WestCare, Beverlyn Coleman. Good morning, Beverlyn.
Hi, good morning. Day, everybody. Thank you for having me on today.
Of course. Thank you for your patience. I know that we're a little bit backed up. It's been a crazy show.
Right, and I understand
No,
that.
I mean, that discussion is worth listening to. It's heartbreaking.
Thank you.
Right.
Thank you.
Now, you guys have a webinar that's coming up on Friday. If you could share the details.
Yes, we do. So I'm the clinical program director for Matlek Naha'ani. Loosely translated, that means bright futures. The literal translation means sunny day or bright day. And so that title is fitting for our program. We provide school-based mental health services And right now we're looking at 3 schools, so we're still kind of in the planning stages. So as we work with our partnership with the Guam Department of Education, we decided to go ahead and put out a webinar. It's a parent webinar, but it's really offered to the community. Of course, the target audience would be parents and guardians, and it's called Trauma Talk, Tips for Mental Wellness for the Whole Family in the Face of Trauma. And as Father Richard and Father Paul and Mrs. Gayleen Cruz were talking, I mean, if that doesn't tell you the kinds of mental stressors that all these families are dealing with, let alone the kids, then I mean, I don't know what else to say. And this is definitely needed now. And so the intent of the webinar is to just talk to parents to recognize signs of trauma or any kind of mental health concerns as their kids are at home. You know, usually the first person to contact the parents would be the schools. You know, the teachers see the kids every day. They might notice a change in their behavior. The school counselor's office is right down the hall where they can go and sit and talk, even if they just need a minute. But they don't have that right now, and they don't have access to that. So it's really, you know, more of the pressures on the parents in addition to their stressors to try to help their kids cope through this, as we all are. And so the webinar, we just felt was the best way we could reach out to the community and help our families.
What are, I guess, some of the signs of trauma?
So some of the signs of trauma, they mimic depression. So it's the, you know, lack of sleep or not sleeping at all, not having a great appetite, just not really connecting with their friends. Because I can tell you, you know, my goddaughter, she's at home, but, you know, they're still texting each other. She's still FaceTimes with her friends. And so that's still that connection they have. So if parents are noticing that they're not really interacting with their friends as much, even if they're online school or doing the worksheets, they're not really focusing, they're having trouble just putting thoughts together. Those are some of the real general signs that they can look out for. It mimics depression, but so it looks the same.
Is this just for GDOE parents, or is this open to everybody?
Yes, this webinar is open to everybody. It's open to parents, guardians, stakeholders in the community that just want to learn more about our program and what we do and how we can better help our youth. The program itself, Maleg Nahani, once we start implementing our services, we're kind of starting out with a narrow scope because we're such a new program. So we are concentrating on 3 schools. And those schools were basically identified by GDOE based on the number of referrals that were received through those schools.
Okay. So wait, did you say it's on a referral basis?
With our program, yes.
Oh, okay.
So with Maleg Nahani, the intent was, when this program started, was to address the trauma that kids experienced as they went through Typhoon Mangkhut. But I mean, the same thing can be said for this pandemic that we're going through now. So we're still in the planning stages with GDOE, understandably, because they've got some things that they're working out. They're just issuing out the laptops. They're still trying to reach to these kids that they've had a hard time getting a hold of. And so there's been a delay, but the intent is that the school counselors would get referrals for any kids that are exhibiting any kind of concerns, and they would do a screening. And based on how they screen and how they score, then they would go ahead and refer those kids to us. So again, we're just starting out in 2 middle schools and 1 high school. We've not yet implemented that yet, but that's the goal of our program.
And finally, Beverlyn, where do people go to sign up for the webinar?
So they can go on westcare.pi. That's the Instagram site for Westcare Pacific Islands. Our flyer's there, our video is there. And then also on Facebook, Westcare Pacific Islands, and there's a link. However, if you are having issues registering, there's an email on the flyer as well, where they can email us and we can help them. Space is limited, so the sooner you get in, the better.
All right. Thank you so much, Beverlyn.
Thank you so
All
much,
right.
too.
Take
Be
care.
safe. Have a good day. Thank you.
You too. Wash your hands.
Again, that was
Yes,
Beverlyn.
me too.
Okay.
Beverlyn Coleman, the clinical program director with WestCare. They're having a webinar this Friday. This is the Thrive Coalition segment. It takes a village to raise healthy and drug-free youth. Thrive with us. And we're going to continue our discussions in the Zoom room. We have from the Department of Public Health, Janella Carrera. She is the Public Information Officer from Public Health, and Bertha Tyron, the Public Health Liaison Officer. Thank you, ladies.
Hi, good morning. Thanks for having us.
Hi, good morning, Sabrina.
Good morning.
We wanted to bring you guys on to maybe clearly outline the process for people coming into Guam who need an exemption, a hardship exemption from quarantine. But before we get into that, just really quick, we were able to speak with the family, the sisters that we interviewed yesterday, and they told us that their hardship exemption was granted and they were released last night. Can you guys confirm that before we get started?
Well, you know, if that's what they're willing to disclose to you, then, I'm glad that they were able to confirm that with you. What we can say is that we worked with the family, and we did find a solution that all parties were able to agree to.
All right, and that being said, Bertha, if you could, or ladies, just walk us through, if I'm in the States or somewhere outside of Guam and I'm coming back in for funeral, death, ill family member, whatever the case may be, what's the process for me to apply for an exemption to the government mandated quarantine?
Sure. Thank you, Chris. So if you're planning on traveling to Guam for a funeral or a family member who's in hospice care, or for some type of hardship request, basically what you would have to do is all our quarantine protocols is laid out in our department's website, but you would have to first go to the government's quarantine facility. You would be transported directly to the QFAC from the airport. And after that, you will be assessed and screened by a team of public health professionals. You also have behavioral health specialists there and a medical team. And so you would have to explain to them your situation, submit supporting documentation, and they will be responsible for reviewing your request based on the urgency. It may take a couple of days for them to make a decision.
Is this something, though, I'm not sure if you mentioned it, is this something that if I'm traveling to Guam, I could make the request from off island, so we're not going through all of this red tape when you get here? Did you say that?
Well, you can make the request prior to your departure. However, the standard procedure based on the guidelines says everybody has to go to QFAC first,
Right.
And then they will be screened there.
But
again, everything is reviewed on a case-by-case basis.
Mm-hmm. And you guys do you recommend that before you travel to Guam, if you're going to make this, if you want an exemption or hardship request, you do it before you get here? Or it doesn't?
Yes, we always encourage the travelers to always take a look at our department's website because the protocols change. And so based on the new or the current protocols, it would give them guidances in terms of what they need to do prior to traveling. So yes, we work closely with them. We're in constant communication with them through emails.
And what type of supporting documents would people who are applying for this process need outside of what's already available on your website?
Sure. If they're coming in for, as an example, a death of a family member, they would probably just need to submit like an obituary or some kind of supporting document like a death certificate. If they're coming in for another hardship, such as a family member who's in hospice care, what I would normally do is ask them to provide maybe some information on the name of the hospice, or if they're in home hospice, we usually reach out to the nurse or to the doctor just to ensure that we have all the information that we need to for our director to make a decision.
There was something that the sister said yesterday about the reason why their hardship request was denied because there was no memorial service that was planned. Does there have to be a memorial service in order for a hardship exemption if you're flying?
You know, Sabrina, I'm very familiar with this case, but however, the part about the memorial service, I'm not aware of. But we did work closely with the family throughout the weekend, through their point of contact, to ensure that we addressed their needs, considering the urgency of the matter. And so we were able to resolve their issue first thing Monday morning.
Do you need to have a negative COVID test prior to arrival when you for the hardship exemption?
That's always very helpful, is to have a negative test for all exemptions, whether you're a CSW, an EHP, or you're requesting for emergency hardship, is to have a negative test upon arrival.
Okay. That was primarily the reason we brought you on, just to get some clarification, and for anybody else that may be flying into Guam because of the loss of a loved one.
Also, I want to add, we do work with each individual if they don't have a negative test. We do work with them to see if we can, offer the negative test in the event that they don't have a negative test upon arrival.
Mm-hmm. And who makes the ultimate decision for the exemptions?
That's with the director.
Oh, Mr. San Augustine.
Right.
Okay.
Yes. Yeah.
All right.
Okay.
Thank you so much.
Thank you, Bertha. Thank you, Janella.
Stay safe.
No problem.
Okay, we'll see you.
Of course. Thank you.
Wash your hands. It's 9 o'clock. We're just right there with our KUAM News Decision 2020, but we're doing this great pizza giveaway with Pepsi.
Yes, we are. So it's National Pizza Month, and so we're asking people to take a picture with your favorite Pepsi product, post it on social media, and tag KUAM News and Uno, and you could win a free pizza.
Yeah. And we're able to go to Crusta yesterday to check out. This is pretty cool. They've actually got one of just about 1,000 authentic certifications for Vera Pizza Napolitana. I probably said that. Vera Pizza Napolitana.
There you go.
It's just so much easier to say. When you're talking like this, I forget about it. You put it in the cheese and you put it in the crust.
You should ask Mr. Fraccassini how to pronounce it.
So yeah, we'll play this little segment here. Pay attention. You can be winning pizzas like this right here on the link, and we'll tell you how you can win with Jason Solis next.
Today's pizza tasting segment is brought to you by Pepsi.
With water, flour, salt, and fresh yeast. And we also use 00 flour, which is the finest flour you can get. It's milled twice, so it's very fine and it's light. It's really good for the dough. Just quality all alone. You get the best flavor, the best texture, you just get the best outcome out of it. It's really the best. So for our pizzas, we're using San Marzano tomatoes from Naples, fresh hand-pulled mozzarella.
We've got the locally grown basil, the hand-crushed San Marzano tomatoes going into this oven. What temperature is that?
800 degrees.
800 degrees.
90-second cook.
Might be oven's hot. Okay, we're here to try this margarita. Of course, this is absolutely 1,000% certified. And it's actually a fork and knife pizza, the way they eat it in Naples. I don't want to mess with the tradition, so I'm actually going to do the fork and the knife. It's the first time for everything. And this pizza was actually invented in the 1800s, and they invented it to impress the Queen of Italy, whose name was, guess what? Margarita. So this is a margarita pizza. Okay, sorry. It's gonna be a rebel here. those hand crushed San Marzano tomatoes. Man, that is tasty. So tasty. The fresh mozzarella. It's creamy, not too heavy. Of course, the basil's got that little bit of freshness to it. But this crust, man, hey, that's why the place is called Crust. Never frozen, fresh made. You know, they got the hand-pulled mozzarella, the hand-crushed tomatoes. This is a winner pizza dinner.
I think what JP had said, it looks so simple, but it is an explosion of flavor inside your mouth. And truly, you can taste every single, I guess, tomato and the cheese. It's just so delicious how everything blends together.
It's crazy if you think about it. I mean, this is a 3-ingredient pizza. You got your tomato sauce, your mozzarella, and your basil. Just 3 ingredients. I don't know. They're making a cornucopia explosion of flavor in my mouth. I love it. Let's get on to this next one here. This is the Alba Brie. This is something that was cooked up by Brian, of course, who's one of the owners here at Crust. And go ahead and I'm just gonna hand this guy. This has got truffle oil on it. So
it's also got an egg in the center.
Get out. Man, that is.
He's speechless. We should all be so thankful.
I know, there's a first time for everything. As you can see, that's why you're supposed to eat it with a fork and a knife. That is delicious. I'm loving this crust. At Crust. We got the margarita, the Alba, and Brie. I'm so happy that these guys are part of our Pepsi pizza giveaway.
Right, you know, the month of October is National Pizza Month, and so we've partnered with a lot of different pizzerias here on island to give away free pizzas. And so all you have to do really is just take a picture with your Pepsi product and then post it on your social media, tagging KUAM News and of course, or Uno, and then they'll select a winner from there, and boom, you could be eating a pizza from Crust.
There you go. It's the 1000% certified VPNs here at Crust. Again, we got the margarita, the Alba. I want to thank JP and Deja and the Crust family for having us here. Hey, and get your entries in because you too could be eating this pizza, and trust me, you're gonna love it. For Sabrina, my name's Chris. Estajos.
Bye.
Today's pizza tasting segment is brought to you by Pepsi.
Celebrate National Pizza Month with a Pepsi Pizza Report. Pepsi helps celebrate this tasty month with an easy way for you to win Pepsi and pizza. Post a photo of yourself enjoying your favorite Pepsi beverage to KUAM News, Uno Instagram, or Facebook pages to enter to win Pepsi and pizza from one of 10 pizza sponsors. Catch the Pepsi Pizza Report every Thursday on KUAM News The Link Morning Show and on the social media pages of KUAM News for reports, tastings, and everything pizza and Pepsi.
Side brand that we have, you know, like good things for the young people. So at Uno Magazine Guam and at KUAM News, let us know how you enjoy Pepsi products, and we could hook you up with some really amazing pizza. And that was the beginning of some really cool things to go around, because you know, there's a lot of places to enjoy pizza on Guam, and we're gonna show you several of them. By the way, why am I saying we, like collectively?
Please do.
Yeah. How? I mean, we're a team here, right?
Yeah.
We've got each other's backs, apparently, unless it comes to going out and eating pizza. Where was I?
All right, Jay. Thanks.
Yeah, Joe sir and I are, you know.
All right, we're going to take a short break. We're coming back with KUAM News Decision 2020. We're going to jump right into it with some candidates for Senator next. 907, we're KUAM FM and Agotni, Guam. This is The Breeze, 93.9. You're listening to The Link. Good morning.
Thrive, a coalition for a drug-free Dedido, is an active partnership of community members and leaders committed to a vibrant, resilient, and empowered Dedido. It takes a village to raise healthy and drug-free youth. Thrive with us. Find us online or email thrive@westcare.com. GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Pepsi Guam Bottling, a local company. We produce your favorite products right here on island, like Pepsi, Mountain Dew, Hanum, Chamorro Punch, Tropical Ice, and more. We've invested millions into local production and will continue to upgrade our facilities and provide local jobs so you can truly buy local. Our long history of producing the freshest and best products will continue. This is our vision. Pepsi Guam Bottling.
Your generosity can change lives. Disasters won't stop during this global pandemic, so neither will we. The Guam chapter of the American Red Cross is calling on the continued support of the community to assist with their mission of providing disaster relief and recovery efforts, military family support, and life-saving training and certifications. In times of emergency, our support will not waver, and we pray that your support of our efforts will continue as well. We invite you to join us in commemorating our 20th annual signature fundraiser virtually this year by supporting the Red Ball in a Box. We will be delivering special red boxes, which include a 4-course dinner from Micronesian Chefs Association and wine to our patrons and sponsors. As a sponsor, your company and message will also be featured in a special television tribute to the Guam chapter of the American Red Cross. For sponsorship opportunities and more information, please call 688-0280 or visit our Instagram or Facebook page. Let's support our community. Though we're apart, we're still together in generosity and support.
These are some of the signs that someone is thinking about suicide. Talking about wanting to die, excessive guilt or shame, and feeling like a burden to others. Feeling empty, hopeless, trapped, or having no reason to live. Feeling extremely sad, anxious, agitated, or full of rage with unbearable emotional or physical pain. Other signs include changing behavior, such as making a plan or researching ways to die, withdrawing from friends or saying goodbye, giving away important items or making a will, taking dangerous risks such as driving extremely fast, displaying extreme mood swings, eating or sleeping more or less, and using drugs or alcohol more often. If you or someone you know is showing these warning signs, get help as soon as possible. Call Guam Behavioral Health and Wellness Center's crisis hotline at 647-8833 or 4.
The rules of engagement, gentlemen, we have in the KUAM News Zoom room a couple Republicans here. Republican senatorial candidate Vince Borja. Good morning, Vince.
Good morning, Chris. Good morning, Sabrina.
Good morning.
Also, we have Republican candidate Don Antonio Ada Edculani. Good morning, Don.
Good morning. Good morning, Chris and Sabrina.
Good morning. The rules of engagement real quick. We're going to give you a 1-minute opening statement. And we're being hard on the time, so when you hit that 1 minute, you will be cut off. Don't take it personal. You'll have 2 minutes to respond to each question, and then you'll be allowed a 2-minute closing statement. That being said, let's jump right into our open. We open here with Republican candidate Vince Borja. Vince, you have 1 minute.
Hi, good morning. Thank you again, Chris and Sabrina, for the invitation. Thank you to KUAM for hosting this event, and thank you to everybody that's tuning in to listen, especially now with the unprecedented times and paying attention to the candidates that are seeking office. This election is going to be one of the most important elections in a very long time. For me, we need to look at ways to grow our economy and diversify it. I want to help veterans get connected with services and fight for better services and benefits for our veterans on Guam. And I definitely want to help create a Guam for our youth so that we can so that we can engage them and have them bring more positivity into the community. Thank you again, and I look forward to sharing my story and sharing my ideas with the listeners in KUAM. Thank you, Chris.
Thank you, Vince. Don, you have 1 minute. Start now.
Unmute.
You got to unmute, Don. It still counts against your time.
I apologize, Chris and Sabrina. I can't really hear your audio very well.
You have 1 minute opening statement. Clock is ticking.
Okay, my name is Don Antonio Ada Edculani, number 12 on the general election ballot for Republican senator. My platform issues are dealing with the homeless, I'm pro-life, and environmental. Please vote for me. I humbly ask for your vote, and I'm ready to answer your questions. Thank you.
Thank you, Don. Sabrina?
I'll start with, Guam currently, it doesn't have a local unemployment program. The PUA, as many of you know, it's going to be running out by the end of this year if Congress doesn't pass another stimulus package. We've been told by several people from public health that we're not out of the woods yet, so we're not sure how much longer we're going to have to be in this pandemic. So do you support legislation for a local unemployment program? And please explain your answer.
We'll start with Vince. Vince, your 2 minutes starts now.
Well, based on the circumstances now, I definitely look at, if I was in office or in January, if that was the issue presented, is definitely look at ways and how that's going to be funded, right? The money's going to have to come from somewhere. So again, obviously right now with unemployment, rising and our economy dipping, I would definitely look at ways to continue to get that program going. But I think for me, I would focus more, I would put a lot more effort into looking at how we can, bring the economy back and continue to create jobs, and not just jobs, but jobs that will bring middle wage income, so that we don't only just continue to, put more money in our pockets, but at the same time help improve the quality of life for our community. And I think that that's where my focus is. But I would definitely look at the circumstances and definitely look at ways or how that will be funded. Because again, our coffers are going to continue to grow small. And like you stated in the question, the federal money, if it runs out, we're going to have to see where that money is going to come from. So that's where I stand on unemployment.
Thank you, Vince. Just so you know, in your timing, you still had about 50 seconds left. Okay, this is a.
Oh, I can't see it on this thing.
Right.
But I'll look at the Facebook. Thanks.
Yeah. All right. Okay, Don, your answer now. You have 2 minutes, Don. Don, you have 2 minutes, Don.
So with unemployment insurance, that's something that it's going to have to be addressed by the local business community. It's come up. I think it's come up before, and I definitely think the Chamber of Commerce has an opinion about it. With me, I would go along with what the majority have to say. Chamber of Commerce, the local business community, the local. As a matter of fact, the 40,000 unemployed, I like to hear what they say. If they want unemployment insurance, I'd be supportive of that. But the thing about that is that I think that might go hand in hand with unions, organized labor, bargaining units. And so that's something that traditionally has not been very much supported in the Guam legislature. And I think it's one of the questions on the liberal questionnaire. I'm not opposed to dialogue about it. I'm not, but as far as the details, I can't say I'd be supportive of it until they come up with a final product. And I definitely am interested in how unions will be involved in it. But generally, I like the idea. But I apologize. There's a lot of nuance details that have to be worked out with everyone. Everyone's a stakeholder. So bottom line is yes, kind of, sort of, yeah.
Yes, kind of, sort of, yeah. Okay, let's move on to the next question. What would you do if elected to improve the legislature's role as a check and balance on the other branches of government in the government of Guam? Vince Borja, 2 minutes starts now.
So, that's a pretty, a very simple answer. Obviously, right now, I think what we can do, especially with the, right now with the Democrats being the majority, there's not enough oversight. And I'm not saying, call a public hearing on everything, but I think, with the community, the concern in the community with transparency and accountability, the legislature can definitely exercise their role as another branch of government versus just kind of rolling with the punches. When you look at a lot of the information put out and you look at why there's a lot of chaos in the community, and for me, I call it communication chaos, because I think there's a lot of contradicting information that gets put out by by the administration. And and truthfully, I mean, there's only one senator or a couple of senators on the same team that does a good job at being able to call, when something's not read, tell everybody it's not read, and ask those tough questions. But definitely ask the tough questions, and I think, be more accessible and be more present is what the community needs. We're not saying to fight with the administration, but I think at the same time, the community wants to hear the legislature especially come out and I mean, honestly, say whether you agree or disagree with the information and the messaging being put out by the administration. And we don't get that. And we don't get that from the majority in the legislatures. So I would definitely work to be able to be that extra voice and to be that extra clarity that I think the community desperately needs right now, because again, there's a lot of contradicting information, and a lot of the policies don't make sense when you say one thing and then you do another thing, but then there are exceptions. So definitely, ask the tough questions and have the hard conversation, which I think that we need right now.
Thank you, Vince. Don, 2 minutes. Your 2 minutes starts now.
Okay, in regards to checks and balances with the administration, definitely think that that's important. Not to be offensive or disrespectful to Governor Lou Leon-Guerrero, but that's the way traditionally our American form of democracy works. There has to be a check and balance between the executive branch and the legislative branch. And usually when that happens, you get better results because people are forced to work harder and come up with better results. The final product is a little bit better. There's an expression necessity is a mother of invention, and we need a lot more better options for our community. And that's going to happen when you have a check and balance between the legislative branch and the executive branch and the judicial branch. Thank you very much.
Sabrina?
Before the Guam legislature, currently there's a bill that would prohibit 1 year, for 1 year, former elected officials to work for the government of Guam under contract or work in any sort of unclassified position. What is your position on this bill? Let's start with Don. We'll start with you, Don.
Don, your 2 minutes starts now.
Can you repeat the question like in 5 seconds? I apologize.
Okay, before the legislature right now, there's a bill that would prohibit for 1 year former elected officials to work for Gov Guam under contract or work in any unclassified or classified position. What is your position on this bill?
I think it's the discretion of the executive branch to choose who they want to appoint for positions, the high positions. That's their prerogative. It's the legislative branch's function to be weigh in on that, whether they agree or disagree. So I think to say you have to limit, you can't work for at least a year. You're limiting the options for the executive branch, and that might not work out well for your political party. If you're the one introducing that bill, in that case, my party, when you get a Republican governor. So I'm thinking the reason that they want to do this is because they feel that there's no other options to have a check and balance. I'm thinking, I've heard them say that there would be like a sunset provision for that. Like maybe, okay, we'll try it out. Maybe we'll try it out. Maybe I don't know. During the pandemic or for the next year or two. I think we'd have to get the people to weigh in on that issue, put it on the ballot, or it's a complicated issue, but I think people have to just.
Thank you, Don. Your time's up. Vince.
Okay.
You have 2 minutes to respond to the question starting now.
Well, so, in regards to the positions that require, credentials and experience, and they meet the criteria, and they go through the interview process just like any other citizen, I'm okay if they get that job. But any political appointed positions, definitely, if they leave public service or leave the legislature or anything in that capacity, and then go, especially right now with COVID-19 and unemployment, again, we're almost over 35,000 people unemployed. It's definitely not the time to be, having political hires with a large salary. And, more than, if they leave the legislature and go for a $25,000 job or $35,000 job, yeah, sure, I doubt that's going to happen. But definitely, I haven't seen the bill in its entirety. But again, if it's for a position that they qualify for, they apply like any other citizen and anybody else in the community, I'm all for it. But not right now with political hires and crazy salaries. That's my stance on that bill.
Thank you, Vince. Next question. You guys are a couple of Republicans. How would a Republican majority be different from the Democratic supermajority we currently have in the Guam legislature? We'll start with you, Don. You have 2 minutes to respond to the question, starting now.
Thank you very much for that question. All right, so I would hope that we would be more inclusive of the Democrat Party in passing bills to law and helping our people during this pandemic with 40,000 people unemployed. And it's really, really disappointing. The Democrat majority right now has not been inclusive of the Republican Party, and it's not helping our people. Definitely not helping the 40,000 people unemployed. So I would hope to think, but I'm a new candidate. I haven't run for office before. I would like to think that the Republican Party would be inclusive of the Democrat Party. If I was in charge, if I was one of the ranking members of the Republican Party, if I be the speaker or chairman of committee on rules, I would push to be more inclusive of Democrats in the bills. So I would think that it would be a lot more inclusive and helping that would help our people more than what we have now, which is the Democrat majority. Thank you for your time.
Thank you, Don. Vince, you have 2 minutes to respond to the question, starting now.
I think what's going to be different with this, if a Republican majority was to happen, is that you definitely have a group of diverse Republicans that are coming, or that will, if most of us get in, a diverse group of Republicans. You got I call them the old guard, right? The ones who have been in public service for over 25, 30 years. You got the new guys like me. You have, honestly, I think there's some of us that came from the other side. I was, for me, more importantly, it's not, I'm not a born and raised Republican. I grew up a Democrat. From Tom and Lou to Angel Santos to we really started politics with Angel Santos when we started, when we camped out at Adelup and he ran for senator. Just the other day I was sharing how when I saw Jose Tarlahi at Mignal. But for me, I think that's something that the Republicans are going to bring is and definitely not a group of soldiers that are going to toe the line with the administration. And I think right now, our community, our government, especially when we talk about transparency and accountability right now, and I think that is one thing that definitely we need to have that other branch of government bring the checks and balances back and restore hope, and I think and accountability and trust in the with our government, not just to the legislature, but with the administration.
Thank you, Vince. Sabrina?
The mayors, village mayors, they are on the front line of every single disaster that occurs here on Guam, although during this pandemic, most and a majority of them feel like they have been at the end of the line. But in one of the recent Mayor's Council of Guam meetings that I actually attended, certain senators were present and several mayors. They appealed to them to address their budget appropriations and how each village mayor gets the same amount of money, same budget, despite their size. So, for example, you have Dededo. They get the same appropriation as, for example, a smaller village like Piri. Do you feel that this is fair? Will you introduce legislation to address this? Why or why not? And we'll start with Vince.
Interestingly, I was at the gym this morning and I was talking to somebody that works at the mayor's office, and they were venting to me about just how overworked they are right now, especially with the coronavirus. And a lot of the, they from PUA to anything government services right now, they have the forms, and I think that, I'll get to answering your question first, because it got very passionate. This question got very passionate about this question this morning because, I get it. I've gone there for little things, and I can imagine. And this is just a small village. Our Baragat is not really a big village compared to Dededo and Jigo. But you're right. When we look at the disparity in the budget, and I've heard this before, before the pandemic, when I was starting to talk to a lot of the mayor's offices. Yeah, it's common sense, and I struggle with why that is not happening at this point. It makes sense. Why would a Ganya, who has a population of, 1,000 something, compared to Dededo, who has, 15, 20,000, get the same budget? It just doesn't make any sense. And then you look at the villages that have a gym, and then the villages that don't have a gym. I think the onus. And I'm going to circle back to another. I was on a farm the other day, and somebody running for office said, public service, blah 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 blah. People who think that it should be part-time have no idea. But I think, for us as senators, as the mayors, their job is to connect with the people and give them to the agencies that should be providing these services. The mayors go above and beyond to help their community and their constituents. And I definitely think that we need to bridge that gap in how funding is being allocated to the villages, for sure, because it doesn't make any sense. And it's not rocket science. I mean, you can figure it out, I can figure it out, and we know that doesn't make any sense. So definitely address it and introduce policy to change that and make it make sense. And I think that, I don't see why that hasn't happened.
Thank you,
Thanks,
Vince. Don, you have 2 minutes to respond to the question starting now.
Okay, I'm trying to see if I understand your question. You're saying that there should be different pay rates for different mayors due to the size of the village? Am I hearing that right?
No, Don. Sabrina's talking about the amount of money that's appropriated from the legislature to the villages. For example, a village like Dededo with a population of 40-some thousand gets the same budget as Umatic, which has, there's 12 people living there. So is that a problem? Do you think the appropriation should be allocated by population or village size?
Okay, here's the thing. There's so many nuanced issues. Definitely have to weigh in on what the mayors feel about it. But I can tell you right now that the homeless population count for hundreds, and they're wandering around, and we're not doing a good enough job. And the mayors, I love the mayors because they are the front line. They're going to have to deal with this issue. I see their frustration and the issues they want to deal with. So as far as funding goes, if you got a nomadic population wandering around homeless without a home, how do you know which village they're going to settle in? They're probably going to go to where they can get food, water, resources, and that's usually in the like a Ganya where there's a low population, but they're showing up in a Ganya. The buses, if they can get up on a bus, they'll take them to a Ganya where they can go find food. Maybe someone will give them food, donate food to them. There's the food pantry as a Karadat over there near Halali. There's all these places that people can go to, and it's not in the big villages, or they might have some of them, but maybe there are farther distances between resources. Whereas in Agana, everything is closer together, so it's a lot more convenient. So each, it's gonna vary. Definitely have to give the mayors to weigh in on it, and
Sorry, Don, your time's up, Don. Sorry. Next question here.
Thank you.
Guys, what letter grade, A through F, would you give the Leon Guerrero Tenorio administration's handling of the coronavirus pandemic? We'll start with you, Vince. You have 2 minutes starting now.
Well, back in March when everything was new and the excuse was this is new to everybody, blah, 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 give me a break, I'd give her a C, right? But I think 7-8 months later, that's no excuse. I mean, the federal government gave millions, almost $1 billion worth of money, that is coming into the economy, and providing a lot of funding to adjust to the new normal. But right now, I'd definitely give them a D, I think, and close to barely passing. I think it's one of those where you can get a D, but you can like in college you can get a C or a D and still graduate, but you don't get or you can still pass a class but not get the degree, because you have to get a C in order to pass. But definitely I think the excuses on this is it's unprecedented is I think it's being overused already, and we've gone through. At this point, we should be able to get things in order. Again, to go back to that question with the mayors and they definitely do a lot more. Mm-hmm. And I think that the community needs to, we need to sometimes remind the community, but that, there are certain things that the mayors do and certain things that senators do, but ultimately it's the administration and the governor's job to ensure that basic government services, whether it be federal funding and their programs, that ultimately falls on the administration. It's not the mayor's responsibility. It's not the senator's responsibility, but it is a senator's job to say, hey, we need to get these things out. We need to get things going. There are thousands of GovQuam workers working from home. There's no excuse why there's a delay in anything in the government when we could move people around to help facilitate, whether it be tax refunds, whether it be unemployment, whether it be the economic payments, whether it be getting food to the families. So I think right now.
Thank you, Vince. Your time is up. Don, you have 2 minutes to respond to the question. Your time starts now, Don.
So again, the question is about the pandemic assistance.
What letter grade would you give the Leon Guerrero Tenorio administration, A through F, for their handling of the coronavirus pandemic?
I would say they got a C, because they're as good as they're doing. The people feel apprehensive, and it's like there needs to be more dialogue, and people want to ask their questions. They don't want to be just spoken to. I really like Leon Guerrero. Something about her makes me think of my Nana, right? But the thing about it is, I need to be able to talk with her. I need to ask her my questions to get her opinions. If she can't just get the impression she's kind of busy. Here's your marching orders. Please do that for 6+ months. Please, Governor Leon Guerrero. Please, more dialogue, interaction, answer questions that people want to ask you. It's not all personal. It's not all just to insult you, or you can have people screen your questions, make sure they're not insulting. But please, I'd say B-, C+. Thank you very much for your time.
All right. My question is kind of just piggyback off of Chris's. And so, Don, again, about your Nana. She cited her superpowers, the governor. She cited her superpowers. It's contained in local law. It's the Emergency Health Powers Act. It's what she cited in terms of doing all of the different things she's been doing to respond to this pandemic. Do you think she has too much power? Do you feel the law should be amended? And if so, in what way? And we'll start with you, Don.
Don, you have 2 minutes to respond to the question starting now.
Sure, yeah. Like I said, it's American traditional form of democracy. Is a balance of power, checks and balances. That's the role of the legislature. Put some reasonable checks on. I love you, but I'm checking you. You've been checked. You're going to respond. You're going to answer some of my questions. I love you, but you're going to answer some of my questions. Okay, Nana? All right. Okay. And when you need help, I'll come and help you. Just ask anytime. But you're gonna answer some of our questions, and we're gonna get it done together. We're gonna get it done. We're gonna help each other out. So yes, definitely should. And I think it was said on a radio station that all it takes is a resolution for 8 senators just to put her have a little bit of a check in the system. So thank you for your time.
Thank you, Don. Vince, you have 2 minutes to respond to the question starting now.
I don't think she has too much power. I think the legislature is underutilizing the power that they have to keep her in check. And so I think, man, you made me lose my train of thought.
Think of your Nana. Think of Nana.
Definitely, the legislature can do a better job at exercising the power that they have to. I think it's ensuring that we're getting clarity on a lot of the questions and a lot of the confusion, a lot of the contradicting policies and orders that they put out. It's indicative, obviously, of everything that's going on with the quarantine, to their initial guidance on what the lockdown was, when we were going to go from P4 to P1 to P2 to 3 or 4, and what was required, and then they started changing based on obviously whatever pressure that came from whatever group, if that's the case. But I think at the end of the day, there's just a lot of contradicting information, a lot of contradicting I guess her orders or whatever. So definitely she doesn't have too much power. I think the legislature can definitely flex their power a little bit more, and ask the tough questions and clarify a lot of things that the community, I think, is questioning. Because I think that's where, like Theresa Lahi, she said she's asked to attend these meetings, and even at that, she hasn't been. She's the public health oversight chairwoman, so that obviously brings the question, obviously, that we definitely need to do more, and I think that the community would appreciate that and respect that from our leaders.
Thank you, Vince. Next question. Let's kind of go off the letter grade for the administration's handling of the pandemic. What letter grade would you guys give the current legislature and their handling of this pandemic? We'll start with you, Don. You have 2 minutes to respond to the question, starting now.
Again, I think I give them C plus, B minus, C plus. I know some people want to give them much worse, but I've been complaining about paying attention to the homeless for 2+ years, and I'm seeing them start to do it. So, I just say do more. I think they're a little bit too much in agreement with the executive branch, and they're not coming up with answers and results that are making the people feel less apprehensive. They're not easing the conscience of the people of Guam. They're not making people feel more confident and their voices heard. But I'd say B minus, C plus. Thank you very much.
Thank you, Don. Vince, you have 2 minutes to respond to the question, starting now.
Well, this is tough. Like being in projects where everybody gets the same grade. I don't think it's fair to some of the good leaders and the ones that are the ones that stand up and fight for our people. But I'd give most of them an F. Honestly, if you look at, most of them are so disconnected from the real problems of the everyday people. When you look at the issues that they're addressing now in the legislature, if we should be talking about unemployment, we should be talking about a plan to open up the government, a plan to open up the economy. We should be talking about crime. The shooting a couple weeks ago, so, and you look at the issues and the laws or bills that are resolutions that are going through the legislature right now during a pandemic. But you know what, though, and honestly, I'm not trying to attack anybody, but I think we shouldn't expect any less, considering that a lot of the issues that we have now existed before COVID, before the coronavirus. The only difference now is that, again, we used, like one of the woman you had, the mourning or the distraught wife that you had earlier, is they're using coronavirus as an excuse for everything. And it's not an excuse anymore. But definitely I would give most of them, there are some good, great senators right now that I would give an A+, but they just can't get the support of their colleagues on both sides to be able to address issues that, again, affect the everyday people. And I think that's what our people need, and that's the direction that we need to go moving forward. Thank you.
Thank you, Vince.
Don, you've been raising this issue just in the past 40 minutes that you've been on, and it's the island's homeless situation. We all know we have a big problem. There has been only one homeless shelter that has been open since this pandemic started. And it's only open, from what I understand, during the declaration of this public health emergency. And so what is your long-term plan to address the island's homeless population?
Don, you have 2 minutes to respond to the question, starting now.
Okay, so like I say, there's been... just me. I've brought this issue up going on 2+ years. I've come across people who are really interested, want to help the homeless. They have information about possible resources. There has been, Senator Moylan came up with Bill 18-35. I think it was killed in committee. I think that the issue was the funding source. So if it's true, then they could just resurrect Bill 18-35, change the funding source to federal funding, and you have your plan to have a homeless shelter and a help center for the homeless. So I would have, you already have this homeless coalition. You have the lieutenant governor with the inter office, was it OHAP? And I would say, get the media, invite the media to those OHAP video conferences with the lieutenant governor, and see if anyone else that wants to weigh in for the public. Increase our collective intelligence. We got really smart people in this island. They're being underutilized. So I think a lot of the funding is going to come first week to ask the federal government, but I have a feeling that there is funding in the private sector, and there are quite a few people in mind that I know that we can reach out to and ask to get involved. Thank you very much for your time.
Thank you, Don. Vince, you have 2 minutes to respond to the questions starting now.
So I think right now with the homeless, we have the federal funds, right? Put them in the shelter. Let's get them, safe, keep them safe, and not have, contribute to the COVID spread or prevent them from getting COVID. But I think the bigger issue is our economy, ensuring that they have opportunity to have jobs, and then mental health. Over the last 10 years, not just here on Guam, I've talked to a lot of homeless people, and one, especially veterans too. When I worked with Westcare and we did a lot of outreach, a lot of them, one, it's either mental health or they just can't get a job, right? Or the transition from the military to the civilian life, which again ties to mental health. But I think we build a good economy, and not just an economy where jobs exist, but bring higher paying jobs so that it helps, put more money on the table. It improves quality of life. But again, I think we have a bigger issue or another issue with this, which is mental health, which is why, you tie everything to, you can tie mental health to homelessness. You can tie mental health to drug addiction and the crime on Guam because it's tied to drugs. But I think a strong economy and more emphasis and more resources to dealing with mental health could definitely deal with, fix that problem and a whole lot of other problems. And that's my stance on that issue. Don't give them a handout, give them a hand up and fund ways so that they could be, contribute more positively to the community versus let's find more money and put you in a shelter that you can stay at until whenever you're ready. No, I think that we can, you build an economy and if there's mental health, we address it and that's how we deal with those issues.
Thank you, Vince. Next question here. What can the legislature do, or if elected, what would you do as a lawmaker to help combat the epidemic of methamphetamines and ice on Guam? You have 2 minutes to respond to this question. Don, your 2 minutes starts now.
Okay, so, we've heard lots of good ideas from the community. I can't take credit for all of them. Ken Leon girl brought up getting a bunch of the sniffer dogs. I agree with that. I have a lot of relatives that are public servants, educators, police force. I've been in contact with some of these drug dogs, and so you got the police who are trained to be handlers. Get the funding and buy a bunch of drug sniffing dogs and go around and do a better job at dealing with this drug epidemic here in Ireland. Thank you very much for your time.
Thank you. Sorry. You lost me when he said you had contact with these sniffer dogs. Oh, man. I love life. Let's go. Vince, you have 2 minutes to respond to the question starting now.
So I think the drug epidemic, I come from, I don't come from that, but I lost my father to drugs when I was in high school. And so I understand and I know firsthand how this impacts family. But I also know a lot of the issues that cause a lot of, that cause people to turn to that. And again, just like homelessness, you look at drug addiction and you look at just the drug problems, period. A lot of it, most of it is stemmed from, mental health, right? Coping. How do we cope with issues? When you look at when you look at some of these, and I can only speak for the people I know, and I know there are a lot of people on Guam that know somebody close to them or somebody in their immediate family that has been affected by this, and it's usually tied to dealing with other issues, that whether it be job loss, whether it be divorce, so I think addressing the mental health issue, we can put cops on the street all day long. Yes, definitely more sniff dogs to assist with catching it before it gets into our community. But the deeper and the bigger problem on Guam is our, the mental health issue and people. And I think coping has a lot to do with why people turn to methamphetamine. Honestly, I will never forget the day my dad told me that he did meth because it makes all his problems go away. And all right, let me catch myself first. But really, that was the reason I asked him. I was like in 7th grade, why do you do drugs? Because we went from having a house and a car to nothing. And I was wondering where everything was going. And we went from a normal house to living on the ranch in a shack. So I know firsthand, and just from that and knowing everybody else who has done it, there was something that stemmed, there was something that happened prior to that, that caused them to turn through that, right? And it was usually somebody else who was already on it offered it as an easy out, a solution to make all their problems go away, a solution to make them feel better about whatever it is they were going through. So I think that's the bigger issue that we need to address. Cops, sure, make the prison bigger, sure, but that's not going to make the problem go away. That just puts them away for a little bit, and then they go back into the streets, and then they just, it's a vicious
Thank you,
cycle.
Vince. Your time is up. Sabrina?
We're not only dealing with a public health crisis, we are dealing with an economic crisis. Businesses are shutting down. Thousands of people are unemployed, furloughed. December comes, and if we don't have any federal help, I'm almost scared to imagine what's going to happen. And so what are your plans to help our island's economy and people that are struggling? We'll start with you, Vince.
So the first thing we need to do is definitely make the one-stop center that we call the one-stop center truly a one-stop center. Being a small business owner and going through the process to start a business, it's painful. It's painful to go from one building to drive to another building to get a permit. And if your paperwork's wrong, you got to go back to the other building that you were before you go to land management to get a stamp. Then you have to go get it notarized before you drive back to the one-stop center to get the last signature before you go to DRT. Like, even that just makes me tired. But definitely need to work on improving that process, because I think at the end of the day, it's not appealing for people to go through. I mean, even right now, just to get your driver's license, I think some people go with it expired because they don't want to go stand in the line. But we definitely need to streamline that. When you look at staying in business, right? Even the permitting process. I know I have a lot of friends I went to college with that work in the construction industry. The permitting process is one of the most painful processes in getting the permits to continue to operate and to do things and to stay in business. So definitely look at ways to incentivize businesses to start and to stay in business, but definitely make it a lot easier. Remove a lot of, there's some things that the government doesn't need to have full control of. And I'm not saying let people go and do whatever, but at the same time, let's remove a lot of the red tape that is unnecessary, because I think that kind of hinders the growth. I think when it's just like employees, when you allow them when you empower them and you give them autonomy to be the best versions of themselves, then they do better versus trying to hold their hands through the entire process. And I think we can do a better job on how we support our businesses and how we help them stay in business.
Thank you, Vince. Don, you have 2 minutes to respond to the question starting now.
Thank you for that question. It really, really gets to me. It pains me to see all these businesses closing down. I think first thing is we should see which businesses need assistance in staying open, and try to assist them. Especially if they are a special service to the community. Like an example, the food shopping centers. I don't think they're having a problem because a lot of people are going there. But like Shirley, Sinaganya. Was it Carmen's in Aganya? What are these restaurants that could be helping feed the people? Chuck E. Cheese, man, Chuck E. Cheese. I think if there's a way to keep a lot of these businesses, small businesses, franchises open, and people like these places, they should definitely take a poll. Hey, these are the businesses that are thinking about going out of business. Should we help them stay in business? And you go to the Small Business Association, go to GITA, go to the governor, plead the governor, hey, help these businesses stay open. Then there's going to be that much less of a struggle to reboot, to get our economy started again and get everything going. So yeah, thanks for your time. Appreciate it.
Thank you, Don. Guys, next question. Who is your biggest inspiration? We'll start with Vince. You have 2 minutes to respond to the question starting now.
Unmute.
For me, my inspiration has always been my younger brothers. You know, being the oldest of 7, there's 7 of us, not including my extended family. You know, everything that I've done over the last 20 years, 25 years was always to be able to be able to give them the things that I never had. Because you know, coming from nothing, I was okay with it, but I also knew that there were other things in the world that I wanted, that I knew that I had to work for. So for me, it was, how do I set an example, and how do I do things that will inspire them to be better than me, to be better than where we came from. And I'm not saying that where we came from was bad, but I definitely know that coming from there and getting to where I'm at now, and I'm not living the great life. I'm not a millionaire. I'm not a billionaire. I'm not, you know, I know what it's like to be able to not know where my next meal was going to come from. I mean, growing up, I think 2 meals was average a day until I joined the Army, and you know, I didn't have a choice, and I ate 3 meals a day. But my brothers have been my inspiration. Everything I do is for them and to inspire them to always want to be better, because I know what it's like to not have that inspiration. I know what it's like to not have anybody to look up to. But that's never ever determined where I went, and that never determined how far I was going to go. And so for me, that's my inspiration.
Thank you, Vince. Don, you have 2 minutes to respond to the question starting now.
I'm so sorry. I have a hard time hearing. Can you repeat it?
Who is your inspiration?
Oh, okay. So I really liked with regards to leadership, island leadership. I'll start out with my elders, my grandparents, especially my grandfather. You know, I looked up to him. He showed me how someone can be a good man, and you know how you carry yourself. Unfortunately, I don't usually live up to his standards. But as far as local leaders, of course, the priests, the ones who haven't been involved in, you know, these certain activities and criminal activities. But there are some good priests out there and nuns. I've been able to go to them for questions regarding, real quick, just creationism versus evolution that we go through as kids in school. My older relatives, whether it be my parents' siblings, my grandparents' siblings, there's so many of them. That just watching them and interacting and following their lead. To some extent, the presidents, a little bit President Trump, more so like President Bush Sr., President Trump. I'm sorry, President Reagan, the Pope John Paul, big one, very big one. Can't forget Pope John Paul, man. He's a big inspiration. Put everything in focus and perspective, spiritually. Man, I'm hoping I'm not forgetting anyone. Some of my teachers.
Don, your time is up.
Really
Thank you for your time.
Thank you, gentlemen.
Thanks for your time. Appreciate it.
Thank you.
Okay, so it's time to close it off. You each have 2 minutes. Closing statement. Don, since you're hot, we'll just go with you right now. You have 2 minutes for your closing statement. Begin now.
Hi, my name is Don Antonio Adequilani. I humbly ask for you to vote for me for a Republican senator in the general election for the 36th Guam legislature. I'm number 12 on the Republican side of the ballot. My issues primarily are focused on centering on homelessness, interest homelessness. I'm very pro-life and environmental, which puts me in league with a lot of Democrats very often, which, it's interesting until they find out I'm kind of pro-life. But anyway, please vote for me. I humbly request for your vote, including a lot of my relatives who I haven't spoken with yet. Please vote for me. And anyone who I haven't met yet, including you all there at KUM. Is it Sabrina and Chris? Please vote for me. Thank you very much for your time.
Don, feel like I know you now. Vince, your closing comments. You have 2 minutes.
Thank you, KUAM, for hosting this forum. Thanks, Chris and Sabrina. Thank you to the listening audience and viewers for taking your time to tune in, especially during these unprecedented times. The election is less than 30 days away, and most of you are still undecided about who you want to vote for. My desire to seek a seat in the next legislature comes from a place of humility, and I understand that our people are struggling and they're frustrated. I'm not here to make any promise. I'm before you to tell you that I hear you and I want to fight for you. To the employees laid off or furloughed, I hear you and I want to fight for you. To the veterans struggling, alone and crying for help, I hear you and I want to fight for you. To our future generations hoping for a Guam that you can live, work, and continue to call Guam your home, I hear you and I want to fight for you. My name is Vince Borja. I'm number 13 on the Republican ballot, and I'm asking you for one of your precious votes this election. Thank you, and thank you, KOAM.
Thank you, Vince. Thank you, Don. Good luck to you in the November general election. Thank you so much for coming on the show.
Thank you for your time, Sabrina, Chris.
Stay safe.
Stay safe. Wash hands.
Wash your hands. You beat me. Thank you, Don. Vince, thank you. All right, there you go. We'll do it again tomorrow. And basically, guys, every show on the link from 9 to 10 a.m. will be dedicated to our KUAM News Decision 2020 candidate interviews. Of course, we'll start with the senatorial. Then we'll do congressional. And then we'll run through the mayors, vice mayors. And that should bring us, and then we'll throw in an after party, icing on top at the end of it all. And that should bring us right into general election day.
Mm-hmm. And if you missed any of that interview, please go to our Facebook page or YouTube and enjoy.
Enjoy. It's good stuff.
Very informative.
Definitely.
Jason's looking at me like, what is she talking about? No, I'm really impressed with the responses we got.
Yeah, it's good stuff.
Mm-hmm.
Don definitely showed the everyman side. I think Vince... as far as detailed information, really presented a lot of ideas, very polished in his responses. Again, Don, very, very accessible. Said the governor reminds him of his Nana. Mm-hmm. Yeah, it was a good discussion.
Yeah.
And we're just trying to do our part to get you guys out there to go and vote, which you can do at the Guam Election Commission, right, Bree?
Yes, and it's by appointment only. Give them a call at 477-9791. Be prepared to go through all sorts of temperature checks and hand sanitizing stations before you go in, because clearly I'm not sure how to use some of those machines that they have. But bring your a pen, a black or blue pen. Masks are mandatory. And for more information, go to gec.guam.gov. And I believe tomorrow we're going to take you through the process of what it's like to go over to the Guam Election Commission in Agana to vote.
Right on. Yeah, you got to take about 58 temperature checks, and it's really safe. They are actually doing a Manumco hour. That's from 9 to 10 a.m. And I was satisfied with all the different protocols and the distancing and all those things.
They're very professional. At GEC, we got to catch up with our dear friend Kenny Boo, so it was good to see him. I hadn't seen him in a while.
Right. It was a whole lot for me to go and vote for two people. You know what I mean? I feel like people they're going.
People.
They're really going to vote. Like, people are going to vote. It's not like a regular election. I feel like a lot of people are going to vote because they're just pissed. They're just like, I'm gonna go vote. Oh yeah, take that. Oh yeah, I saw you on the link. You're done. Okay. By the way, the show is proudly brought to you by Carrier, Cowboy Enterprises, and IT&E. Some of the takeaways from this morning, Bree, there's an outbreak that's being contained at a Guam Behavioral Health and Wellness Center youth group home. Every single body in that home is positive for the coronavirus. They've sealed off the home. The staff is there, sequestered, quarantined, isolated, if you will, with 3
clients.
Two 16-year-olds.
And 1 9-year-old.
Right.
And it was 7 staff. And of course, all of us are mourning the loss of 3 more COVID fatalities that were announced last night by the JIC. And so our condolences to the families.
And we also spoke with Gayleen Cruz in an emotional interview, pleading with GRMC to allow for caregivers and to attend to patients, non-COVID patients who are hospitalized. GRMC. We also heard from Fathers Paul and Father Richard, who said that this is something they hear about all too often from the people in their flock, is that they're sick people in the hospital who don't have COVID, who are fighting their afflictions alone, who are dying alone.
Yeah.
And it's been the subject of a lot of counseling that they've had to do.
Praying for compassion. We also had an update to the interview we had yesterday with the three sisters that flew to Guam after the passing of their sister, and their hardship request exemption had been denied, but through the help of Senator Sabina Perez's office, they managed to get them tested. It was expedited, and they were released to home quarantine to grieve with their family.
Right, and we had asked them to come on, but the response was that they're going to now focus on why they came here in the first place. So again, our condolences, thoughts, and prayers, and all that going out to their family, going out to Galen's family, and to all those who are struggling, suffering, sick with this virus, and their friends and families. Definitely could use more prayers all the time. It's 10:03. Thank you, Joe, sir. Thank you, Kengineer. Thank you, Master Control. Thank you, Jason Solis.
I'm Sabrina Salas Matsanani. Thanks for listening, watching, streaming.
Thank
Please
you.
Stay safe.
My name is Chris. Appreciate it, guys. Leaving you with this one from last minute. It's 0 down. Está. Adios.